The trauma bay at Hargrove Memorial Hospital smelled like iron and burning rubber, and the floor was already slick with blood before the second wave of ambulances even pulled in. 43 minutes after a fuel tanker detonated on the Colton overpass. Outside Millhaven, Colorado, the emergency department had stopped being a hospital and started being something closer to a battlefield. Bodies arriving faster than beds could clear, monitors screaming over each other, residents shouting into phones that nobody on the other end was answering. And in the center of it all, a 32-year-old nurse named Sera Voss stood at the foot of bed 7 with her gloved hands at her sides, watching a first-year resident named Dr. Paul Greer press a suction catheter into a chest wound with the wrong angle, the wrong pressure, and the absolute certainty of someone who had never seen a person die in front of them before. She had seen it, more times than she could count, more times than she ever talked about. "You're going to collapse the lung," she said, quietly. No alarm in her voice, because alarm costs seconds. Greer looked up. He was 26, maybe 27, with an expensive watch and the kind of jaw that made nurses at the station talk. He looked at her the way he always looked at her, like she was furniture that had suddenly started making noise. "I've got this," he said. He didn't have it. The patient, a man in his mid-40s with construction company branding on what was left of his jacket, had a penetrating chest injury from what appeared to be shrapnel, a fragment of guardrail from the look of the wound's entry track. His pressure was 74/40 and dropping. His lips were going gray. Sera watched Greer adjust the catheter, pushing deeper, angling wrong. She stepped forward. "Move to 11 o'clock, she said. "You're sitting too medial. You're going to hit the mediastinum." "I said I've got—" The monitor spiked, flatlined for 2 seconds, came back, ragged and weak. Greer went still. Everyone in the bay went still. Sera put her hand over his, adjusted the angle herself, and felt the shift, the correct resistance, the small release of pressure that meant the catheter had found its path. The monitor steadied. Not good, not stable, but alive. Greer pulled his hand back. He didn't say thank you. He looked at the monitor, then at the patient, then at his own hands like they'd betrayed him somehow. Sera stepped back to where she'd been standing before. Nobody in the bay said anything. That was how it always went. Millhaven was the kind of city that had been almost great twice and settled for adequate somewhere in between. 200,000 people, a university hospital on the north end, 3 urgent care chains, and Hargrove Memorial sitting squarely in the working-class South District, underfunded and overworked and quietly proud of the fact that it handled everything the North End sent away. Sera had been at Hargrove for 4 years. Before that, she'd been somewhere else entirely. She didn't talk about it at work. Not because she was ashamed of it, she wasn't, but because the moment you said combat medic, something changed in how people heard you. Either they treated you like a curiosity, wanting the stories, the gore, the action, or they treated you like someone who needed watching, someone who'd snap under pressure, or had already snapped once and been put back together imperfectly. Neither version was useful. Neither version let you do your job. So she was just a nurse. She'd been called that enough times that the words had lost their edge. In the break room, Dr. Margot Hale, the head of emergency medicine, kept a habit of reviewing the night's incident board with whoever happened to be present, and she had a particular way of saying nursing staff that managed to make it sound like a separate and lesser civilization. She wasn't cruel about it. Sera had worked under genuinely cruel people, and Hale didn't reach that bar. But there was a consistent, low-grade indifference to anything that happened below the physician threshold, a kind of institutional static that said, "Your observations are noted and will not be acted upon." Sera had filed 3 clinical concern reports in the past 8 months. 2 about medication protocol gaps she'd noticed during shift handoff. 1 about a recurring mislabeling issue in the trauma supply cabinet that had caused 2 near misses she was certain would eventually cause something worse. All 3 reports had been acknowledged. None had been acted on. She'd stopped writing reports. She'd started keeping notes instead. In a small notebook she kept in her locker, in handwriting tight enough that no one would bother to decode it. Not for any plan, just because the habit of documentation had been beaten into her by people who understood that memory was fallible and paper wasn't. 8 years in the Army Medical Corps had given her a lot of habits like that. The Colton overpass explosion had started as a single 911 call at 11:47 p.m. and become a mass casualty event by midnight. By 12:15, Hargrove's ER had received 19 patients. By 12:30, it was 26. The highway was still burning. News helicopters were already circling. Dr. Hale had ordered the trauma bays expanded into the overflow corridor and pulled every available attending into service. The chief of surgery, Dr. Warren Bask, was in OR1 on a separate case that had begun 3 hours earlier and couldn't be handed off. His second, Dr. Delia Fong, was in OR2 with an aortic repair that had gone long. That left the trauma floor running on 2 attendings, 3 residents, and 6 nurses, and the attendings were already splitting between patients faster than anyone could track. Sera was assigned to the overflow corridor, technically a step below the trauma bays, which everyone understood to mean the patients with a lower immediate priority, except that tonight, because of the volume, lower immediate priority meant someone will get to you when someone gets to you, which was not the same as stable. She was cycling between beds 12 and 14 when she saw the man in bed 11. He hadn't been there 20 minutes ago. He was lying on his back with a nasal cannula in place and a triage band on his wrist, green, which meant he'd been assessed as non-critical. His chart listed him as James Okafor, 51, male, brought in by a bystander who had found him on the ground near the overpass perimeter. Complaint, confusion, abdominal pain. Sera glanced at his face. She stopped. The color was wrong. Not pale, not flushed. A specific grayish-yellow undertone she had learned to recognize in places where there was no CT scanner and no time to wait. She picked up his chart. The triage nurse who'd assessed him had noted, patient ambulatory on arrival, alert and oriented X2, complaining of abdominal cramping, no obvious external injuries, vitals within acceptable range. His blood pressure on arrival had been 102/68. She looked at him now and touched the back of her hand to his forearm. Cool. Not cold, but cooling. She put 2 fingers to his radial pulse. 40 beats a minute. Maybe 42. And weak. The kind of weak that meant the heart was compensating for something it was going to lose the fight against. She put the chart down and leaned over him. "Mr. Okafor, can you hear me?" His eyes opened, slowly, like the lids weighed something. "Yeah," he said. His voice had the flat, slightly distant quality of someone whose brain wasn't getting quite enough of what it needed. "My stomach hurts." "Where exactly?" "All over. Started in the middle." A pause. "Worse now." "On a scale of 1 to 10? He thought about it. The fact that he had to think about it told her more than the answer did. 7, he said. "Maybe 8. She pressed gently on his upper abdomen. He winced. She moved lower toward the left quadrant, pressed again. He made a sound that wasn't a wince, sharper, involuntary. She straightened. In 8 years, she had learned that the body communicated in specific languages. Penetrating injuries spoke loudly. They announced themselves through blood and visible damage, and the frantic visible panic of the person bleeding. Blunt injuries were quieter. They hid inside. They let you walk in through the door, answer questions, sit down on a triage bed, and tell a nurse your pain level, and then they killed you slowly in the background while everyone was looking at the people who were louder. She looked at Okafor's abdomen. No external bruising visible yet. That meant nothing. Bruising from internal bleeding often took 30 to 40 minutes to surface. He'd been hit by something, or thrown or landed badly. And something inside him was bleeding, and his body had spent the last hour compensating, and compensation had a ceiling. She went to the corridor station. Dr. Aaron Spill was the attending assigned to overflow. He was 53, experienced, competent in the way that came from decades of repetition rather than exceptional instinct. He was currently across the corridor with a patient in bed 16 who was actively seizing. She waited 40 seconds. He didn't look up. She went to the nurse's station and flagged the charge nurse, Linda Park, who had been at Hargrove for 11 years and had the practice deficiency of someone who'd survived a lot of bad nights. 11 needs a re-eval, Sera said. Triage green, but I think he's bleeding internally. Left-sided guarding, dropping pressure pattern, mental status change. Linda looked at the board. Spills with the seizure. I know, he needs a stat abdomen CT or a fast exam, and he needs it in the next 15 minutes. Linda looked at her, not dismissively. Linda never dismissed Sera, which was one of the reasons Sera respected her, but with the specific calculation of someone who was managing 12 things at once and had been asked to add a 13th. "I'll flag it," Linda said. "How long?" "Sera." "Linda." He walked in. "That means nobody's looking at him. He's going to lose his pressure in the next 20 minutes, and whoever finds him is going to say they don't know how this happened." Linda's eyes moved back to the board, then to the corridor, then to Sera. "Give me 5 minutes," she said. Sera went back to 11. She rechecked the pulse. 38. She hung a second IV line herself, wide open, normal saline. She rechecked his pressure with the portable cuff. 88/54. She pulled the crash cart to the mouth of the bay, close enough to reach in 6 steps. She was there when Linda came back with Dr. Spill 3 minutes later. He looked at the monitor, at the cuff reading, and at Sera. "You changed his IV rate," he said. "Yes." "Who authorized that?" "He was compensating for internal blood loss and his pressure was crashing," she said. "I hung a volume bolus to buy time." Spill looked at her with the particular exhausted irritation of someone who'd been interrupted mid-crisis and didn't have bandwidth for surprises. "That's a physician order. There was no physician available. That's not—" He stopped, looked at the monitor again, recalculated. "Get me a portable fast." The ultrasound confirmed it 3 minutes later. Free fluid in the abdomen, significant volume, and more accumulating. Okafor had a splenic laceration from blunt trauma. Grade 3, possibly 4. Spill got on the phone with the OR. Okafor went up to surgery 12 minutes later. The surgery took 40 minutes. The surgeon who did it, a general surgery attending named Dr. Bethany Ruiz, who'd come in on emergency call, told Linda afterward that if they'd waited another 30 minutes, there wouldn't have been enough volume left to work with. Nobody told Sera this directly. She found out because Linda told her during shift change, quietly, in the corridor. "He made it," Linda said. Sera nodded. "Spill filed a nursing protocol deviation report," Linda added, carefully. Sera wasn't surprised. "I know. Hale's going to want to talk to you tomorrow." "I know that too." She went to her locker, changed her shoes, and drove home in the dark. The radio was off. She didn't need noise. She'd learned to drive in silence a long time ago, on roads that weren't roads exactly, in vehicles that were nothing like her 12-year-old Civic, in a country where the dark meant something different than it did here. She was not a woman who pitied herself. But she was honest enough, in the quiet parts of herself, to recognize the specific fatigue that came from spending years doing work that mattered and being consistently treated as someone who didn't. She ate half a sandwich over the sink. She showered. She slept for 6 hours. And the next morning she drove back to Hargrove Memorial, because that was what she did. Dr. Margot Hale's office was on the 2nd floor, past the administrative suite, with a window that looked out over the parking structure instead of anything worth looking at. It was a detail that Sera had always found appropriate. Hale was a woman of interior spaces. She operated through memos and meetings and carefully worded policy language, not through the visceral reality of the floors below. The meeting was at 8:30. Hale sat behind her desk with Spill's protocol deviation report in front of her and the expression of someone who had already decided how this conversation was going to end. "You administered IV fluids without a physician order," Hale said. "I did," Sera said. She was sitting across from Hale with her hands in her lap and her back straight. Old posture. The kind you didn't entirely lose. That's a clear violation of nursing scope of practice under Hargrove's clinical guidelines. The patient was hemodynamically compromised, the attending was unavailable, and the delay in intervention would have been incompatible with survival. Hale looked at her. "That's a physician determination to make. In an emergency, the determination gets made by whoever is present. By someone with the clinical authority to make it." Sera held the pause for a moment. She was very good at pauses. She'd learned them in places where silence was a tool. "With respect, Dr. Hale, clinical authority and clinical knowledge are not the same thing. I identified a compensated hemorrhagic shock presentation in a green-tagged patient. I bought him 20 minutes that got him to surgery. He's alive this morning. The deviation report doesn't change any of that." Hale's expression didn't change. But something behind it did. A small recalibration, like a door being quietly closed. We're issuing a formal reprimand, Hale said. It will be placed in your personnel file. Additionally, pending review, your trauma bay assignments are being suspended. Sera looked at her. You're moving me out of trauma. You'll be reassigned to observation and post-procedure. The thing about that, the thing that Sera sat with for a long moment before responding, was not the injustice of it exactly. It was the precision of the punishment. Observation and post-procedure was where nurses went when someone wanted to neutralize them without firing them. Low acuity, low stakes, low visibility. It was designed to make you either leave on your own or slowly disappear. Is this permanent? She asked. It's pending review, which meant indefinitely. All right, Sera said. Hale looked mildly surprised, like she'd expected more. You can file a grievance through HR if you... I understand the process, Sera said. She stood up, thanked Hale for her time, genuinely, without sarcasm, because whatever else you did, you thanked people for their time, and walked out of the office and down the stairs and back to the floor, where she picked up her assignment sheet for the day. Observation ward, beds 41 through 48. She folded the sheet once and put it in her pocket and went to work. The observation ward was quieter than she was used to. Quieter in a way that had edges. Not peaceful, just inert. Patients recovering, waiting, stable by definition. A broken wrist in 42. A chest pain rule out in 45, almost certainly musculoskeletal. A woman in 47 who'd had a laparoscopic procedure that morning and was waiting on her pain levels to come down enough to discharge. Sera checked vitals, hung fluids, updated charts, answered call lights. She did it efficiently, without complaint, because the work itself wasn't beneath her. No work was beneath her. She'd learned that in a tent hospital, in a country where the roof was canvas and the floor was packed earth, and you did what needed doing, and you did not complain about it. But she was aware, in the specific low-frequency way of someone whose skills were being deliberately wasted, that she was standing in the wrong room. Linda found her at noon in the corridor outside 44. You heard about the overnight? Linda asked. Some of it. Okafor's out of the ICU. They moved him to step down this morning. Sera nodded. Ruiz told Basque it was the fastest field identification she'd seen in a blunt abdominal case in 5 years, Linda said. She didn't know who caught it initially, but she said whoever it was had an unusual eye for compensated shock. She said that. Word gets around in surgical circles, Linda said. Sera looked at her. How long has Hale had me flagged? Linda was quiet for a moment. There's a file, Linda said. I don't have access to it, but I've heard things. The medication reports you filed. The supply cabinet issue. Someone made a note, something about, and I'm paraphrasing, staff exceeding professional scope on a recurrent basis. I filed reports. I know. I documented clinical safety concerns through the appropriate channels. I know, Sera. The thing about institutional punishment was that it rarely came for one thing. It accumulated. It waited until the moment you did something visible, something that could be framed as a rule violation, and then it arrived with the full weight of everything that had been building behind it. The fluids she'd hung for Okafor were not the real issue. The real issue was that she kept being right about things that people with more authority preferred not to be wrong about. She went back to work. The second explosion hit the news at 2:17 p.m. Not a second highway incident, a building, the Brannock Industrial Warehouse on the south edge of Mill Haven, 3 blocks from the docks. Gas leak that had been reported 3 times to the city in the past 4 months and never addressed. When it went, it took most of the western wall with it, and the collapse brought down 2 floors of the adjacent structure, which turned out to be a converted commercial space with 38 workers inside. The first ambulances arrived at Hargrove at 2:38. Sera heard the mass casualty alert go out over the PA and stood still for exactly 3 seconds in the observation corridor, listening to the sound of the floor changing below her. The pace shifting, the voices changing register. She finished updating the chart she was working on, completed it cleanly, saved it, clipped her pen. She was not assigned to trauma. She stayed where she was. By 3:15, 7 patients had come in with serious injuries. By 3:30, 11. The 2 attendings in the ER had been joined by Basque himself, who had come down from the surgical suite still in his OR cap, and by a trauma fellow named Dr. Marcus Webb, who was technically still on research rotation but had shown up because mass casualty events had a gravity that pulled physicians from wherever they were. Sera could hear the noise from where she was. She was checking a blood pressure cuff on the woman in 47 when she heard the code called. Not a standard code, a trauma code, which had a different tone to it, a different quality of urgency, the kind that meant someone had arrived in a condition that required immediate intervention with multiple disciplines, or they were going to die in the next few minutes. Trauma Bay 3. She stayed in 47. She adjusted the woman's pillow. She noted the blood pressure. She updated the chart. The PA called again, this time asking for any available surgical personnel to report to Trauma 3. Available surgical personnel, which meant whoever was in 3 was using everyone available and still needed more. The woman in 47 looked at her. She was 54, had dark brown hair going silver at the temples, and had spent most of the afternoon watching Sera work with the watchful quietness of someone who had been in enough hospitals to understand what was actually happening around her. "You should go," she said. Sera looked up. "I can see you listening," the woman said. Not unkindly, just direct. "You've been listening to that floor for the past 45 minutes. Whatever's happening down there, you know something about it." "I'm assigned to this ward," Sera said. "I'm aware of that," the woman said. "I'm also aware that you adjusted my IV rate twice in the past hour in response to things I didn't consciously notice, and that both times my discomfort went down. You're not an observation nurse. You're something else." Sera was quiet. "Go," the woman said. "I'll be fine. I've been sitting in this bed for 4 hours. Another hour won't kill me." The PA went again. "All available clinical staff to Trauma 3. Repeat, all available." Sera set down the chart. She looked at the woman in 47 for a moment. "I'll be back to check on you," she said. She walked out of the observation ward, through the corridor, down the stairs, and pushed through the trauma bay doors. The scene in Trauma 3 had the specific quality of controlled panic, the kind where everyone was moving fast and purposefully and doing the right things, but the right things weren't working. The patient was a male, roughly mid-30s, with crushing injuries to the chest and upper abdomen. He had been brought in from the warehouse collapse, one of the workers who had been on the second floor when the interior structure failed. The trauma team had him intubated and on 2 large-bore IVs, and Dr. Webb was at the head of the bed managing the airway, while a second resident, Dr. Priya Anand, was attempting to stabilize the chest. Bask was at the door, on his phone. From the look of him, he was trying to reach an interventional radiologist. Sera scanned the patient from the doorway. Something was wrong. Not wrong with what the team was doing. The airway management was correct. The fluid resuscitation was appropriate. Wrong with the picture. Wrong with what the monitor was showing, and what the patient's body was doing, and the space between those two things. She stepped inside. "What's his mechanism?" she asked Anand. Anand looked up. She was in her second year, good instincts, tired. "Crush injury, partial structural collapse. He was found under 2 sections of concrete flooring. GCS was 7 at the scene." "How long under before extraction?" 18 minutes, approximately." Sera looked at the pressure reading. "His mean arterial pressure is climbing." "We've got him responding to fluids," Anand said. "That's not a fluid response. His heart rate's dropping and his pressure's going up. That's Cushing's." Anand went still. Cushing's reflex, rising blood pressure, falling heart rate, was the body's last resort mechanism to maintain perfusion to the brain under conditions of critically elevated intracranial pressure. It was not a sign of improvement. It was the warning that came before the brain herniated. "He doesn't have a head CT, Anand said. "He can't go to CT, Sera said. "Look at his pupils." Anand leaned over the patient and lifted his eyelid with a gloved thumb. Left pupil, blown, fixed and dilated. She checked the right. Right pupil, sluggish, beginning to fix. "Call neurosurgery," Sera said. "Now. And get a Foley in and start hyperosmolar therapy. He needs mannitol or hypertonic saline immediately to buy time before they can drill." Anand was already reaching for the phone. Webb looked up from the airway. He was 5 years out of medical school, experienced, and he had the expression of someone who had just been told something that reoriented his understanding of what was happening in the room. "Where did you—" he started. "Trauma nursing," Sera said. "Mannitol. And tell neurosurgery it's transtentorial herniation in progress, or they'll take their time coming down." Webb stared at her for one long second. Then he turned to Anand. "Do it," he said. Bass came through the door at that moment, still holding his phone, and saw the team pivoting, saw Sera standing in the center of the trauma bay, and stopped. His eyes moved to her scrubs, her badge, the assignment tab that still said observation, beds 41 to 48. He looked at the patient, at the monitor, at Anand drawing up the mannitol. "What's happening?" he said. Nobody answered him immediately, because the person who would have answered him was already moving to the other side of the bed, checking the patient's bilateral hand grip, watching for posturing, reading the seconds before neurosurgery arrived, as if every one of them was a page she already knew by heart. And she was right. She did know them, had known them in different rooms in different countries, and in the dark, with nothing but her hands and whatever she could find, and the absolute certainty that she was the most experienced person present, whether anyone acknowledged it or not. The neurosurgery fellow arrived at 3:47 p.m. The patient went to emergency OR at 3:52. In the aftermath, while the team was documenting and the monitors were being reset and the bay was being cleaned for the next arrival, Webb stood in the doorway and looked at Sera. She was writing in her small notebook, the tight handwriting, the one nobody else read. "That was a combat medicine assessment," Webb said. She didn't look up. It was a clinical assessment. The transtentorial herniation pattern. The way you called the Cushing's reflex before the pupils were fully blown. That's not standard nursing curriculum. He paused. "I did a rotation with an Army trauma unit during my 3rd year. I recognized the pattern recognition." Sera closed the notebook. She looked at him. "The patient needs to be in OR," she said. "Is there anything else you need from me right now?" Webb was quiet for a moment. "No," he said. "But Bask saw you in here. He knows you're not supposed to be on this floor." "I know. He's going to file something." "I know that too." She walked past him, out of the trauma bay, back toward the observation corridor. Her shoes were quiet on the tile. She moved the way she'd always moved. Not quickly, not slowly, but with the particular unhurried precision of someone who had spent years in environments where running drew attention and attention had consequences. She pushed through the doors to the stairwell. She was 3 steps up when her pager went off. Not the unit pager. Her personal one. The one registered to a number she had given to no one at Hargrove, a number that had been dormant for 4 years, and that she had almost convinced herself was as dead as everything else from that part of her life. She stopped on the stairs. She looked at the message. 4 words. A sender ID she recognized from a long time ago. "We need to talk." The pager number traced back to Fort Delaney, Colorado, 118 miles north of Mill Haven, where the Army's 5th Medical Brigade had been stationed for the past decade, running the regional trauma support infrastructure that most civilians didn't know existed, and the hospital administrators of Mill Haven had always been careful not to think too hard about. She stood on the stairs for a moment, then she put the pager in her pocket and walked up to the observation ward, where the woman in 47 was waiting, and she went back to work. By 6 p.m., the Brannock industrial incident had produced 31 hospital admissions across Mill Haven's 3 major facilities, and Hargrove had taken the heaviest load. Bask had been on his feet for 9 hours. Hale had come down from administration twice to tour the floor with the particular expression of someone trying to look in command of a situation she was several steps behind. Sera finished her shift at 7. She documented everything, handed off cleanly, and was changing her shoes in the locker room when Linda appeared at the door. "Bask filed a report," Linda said. "Protocol violation. Unauthorized presence in a restricted clinical area during an active trauma." Sera put her street shoes on. "I expected that." "There's going to be a review, HR and clinical governance. Hale's office is initiating it." "When?" "End of the week, probably. They'll put you on administrative leave until the review is complete," Sera said. "I know." Linda looked at her for a moment. There was something in her face beyond the practical, a quiet kind of frustration, the kind that accumulated in a person who had watched a system run backward for long enough. "The man in OR2, Linda said. "The one from the warehouse. He's out of surgery. They got to him in time." Sera closed her locker. "Good," she said. "His wife's in the waiting room. She doesn't know who to thank." "She doesn't need to." Sera, "Good night, Linda." She walked out to the parking lot in the dark. The night air was cold and smelled faintly of smoke. The Brannock fire was still being suppressed on the south side of the city, and the wind was coming from that direction. She got in her Civic. She put her hands on the wheel. She took out the pager and looked at the message again. "We need to talk." 4 years was a long time. Long enough to build something that looked like a normal life from the outside. Long enough that some days the 8 years before felt like they'd happened to someone else, in a different body, under a different sky. But she'd never changed the pager number. And whoever had sent the message knew that, which meant they'd known exactly how to find her, and they'd waited until now to do it. She started the car, pulled out of the lot, and drove through Millhaven's South District with the windows down and the cold air coming in, and somewhere on the drive she realized that the feeling she'd been carrying since 3:15 p.m., since the code, since Trauma 3, since the pager going off in the stairwell, was not dread. It was something older than dread. Older than anything this city had asked of her. It felt like the beginning of something that had never really ended. She drove for 20 minutes before she called the number back. Not because she needed 20 minutes to decide. She'd decided somewhere around the third traffic light, in the cold window dark with the smoke smell still on her clothes. She needed 20 minutes because calling back required a different kind of stillness than the one she'd been operating in all day, and she needed to find it before she spoke. She pulled off on a side street 2 blocks from her apartment, put the car in park, and dialed. It rang twice. Voss. The voice on the other end was male, mid-50s, with the particular stripped-down quality of someone who had spent decades communicating in environments where every word was either necessary or absent. She recognized it immediately, the way you recognized a sound that had been part of your life's architecture for years, and then went quiet. "Colonel Tran," she said, "you're still in Millhaven." "I am. We need to meet, tomorrow morning. There's a diner on Caldwell Street, South Side, the one next to the automotive place. 7 a.m. She knew the diner. She'd been going there for 4 years without knowing that anyone from her previous life knew she existed in this city. "You want to tell me what this is about?" she asked. A pause. Not a hesitant pause. A considered one, the kind that meant he was deciding not how much to say, but in what order. "The Brannock warehouse," he said, "and 3 other incidents in the past 18 months that we've been tracking. There's a pattern, Voss. And it ends in Millhaven." She looked through the windshield at the dark street. A cat crossed under a streetlight. Normal street, normal night, normal city. 7 a.m., she said. She hung up. She sat for another minute. Then she drove the 2 blocks home, ate dinner standing up, and went to bed. She didn't sleep well, but that wasn't unusual. Colonel Daniel Tran looked exactly as she remembered him, which was to say, he looked like someone who had decided at some point in his 40s to stop aging out of sheer stubbornness. He was 61 now, with silver at his temples and the kind of posture that came from 40 years of the army telling you that your spine was a military asset. He was already in the booth when she arrived, with a coffee he hadn't touched, and a manila folder he'd turned face down on the table. She sat across from him. The diner was mostly empty. 2 truckers at the counter, a woman with a laptop by the window, the quiet clink of a kitchen getting started. "You look tired," he said. "I had a long shift." "I heard." He turned the folder over. Transtentorial herniation identification in an unmonitored crush injury presentation. Warehouse incident, yesterday afternoon. He tapped the page. Webb's incident documentation. He noted the assessment came from a, and I'm quoting, floor nurse reassigned to observation, who identified the Cushing's pattern 7 minutes before bilateral pupil changes were fully expressed. Sera looked at the folder. "He filed that already." "Webb is thorough," Tran said. "He was also in contact with Fort Delaney's medical liaison office this morning. Not because of you specifically. He was trying to access regional trauma support resources for an ongoing MCI protocol review, but your name came up in a search." "My name shouldn't be in any search." "Your name isn't," Tran said. "Your technique is." He opened the folder and turned it toward her. "There are 3 prior incident reports from Hargrove in the past 4 years. 2 medication safety identifications. 1 supply chain discrepancy that, if you trace it correctly, connects to a falsified procurement order that ultimately relates to the Brannock building's gas system." She went still. Not visibly still, she'd been trained too well for that. But internally, the way a person goes still when the shape of something shifts into a form they weren't expecting. "Explain that last part," she said. Tran turned to a second page. It was a procurement document, official municipal header, the Millhaven City Infrastructure Division, dated 14 months ago. There were 2 line items highlighted in yellow. 3 years ago, Brannock Industrial applied for a gas system safety upgrade, Tran said. The city approved the work order, funds were allocated. The contractor who won the bid was a company called Aldervane Industrial Solutions. I've never heard of them. No one had. 18 months ago, they were incorporated 8 months before they won the bid. The sole officer of record is a man named Gerald Paust, who has a background in waste management logistics and no engineering credentials whatsoever. Tran paused. The gas system work at Brannock was never performed. The inspection records were filed as complete. The inspector who signed off on them retired 3 months later at 54. Sera looked at the document. People died yesterday. 4 confirmed, 11 still in critical condition as of this morning. She was quiet for a moment. What does this have to do with me? She asked. Specifically. Tran looked at her over the rim of his untouched coffee. The supply chain discrepancy you flagged 18 months ago. The mislabeled inventory in Hargrove's trauma supply cabinet. Nobody acted on it. No, but we did. He pulled out another page. 2 of the components you flagged as incorrectly cataloged were medical-grade pressure regulation valves, the same type used in industrial gas system maintenance. They were listed in Hargrove's supply manifest under surgical equipment codes, which meant they'd been diverted from their actual purpose and laundered through the hospital's procurement system. She stared at him. Someone used Hargrove Memorial's supply chain to divert critical infrastructure components, he said. The report you filed 18 months ago was the first documentation we found that traced the diversion, and the person who received your report and chose not to act on it. Hail, she said. Tran didn't confirm it. He didn't have to. I need you to understand something, he said. This is a federal matter now. The Army's involvement comes through our contract with the Regional Infrastructure Support Office. Don't ask me to explain that particular bureaucratic architecture. It would take 3 hours. What matters is that we have jurisdiction to conduct an inquiry, and the inquiry has reached a point where we need someone inside Hargrove who understands both the clinical and the procurement side well enough to help us document what happened. Sera folded her hands on the table. She thought about Hale's office, the reprimand, the transfer to observation, the file Linda had mentioned, staff exceeding professional scope on a recurrent basis, which now read not as bureaucratic cover for professional jealousy, but as something more deliberate, more premeditated. She knew, Sera said. She's known about my reports for 18 months. She's been managing me. We believe so, yes. She put me in observation to reduce my visibility, to keep me away from the supply chain and the procurement systems I'd already flagged. Which makes you the most important witness we have, Tran said, and also the most exposed person in that building. She looked at him. You're telling me I'm in danger. I'm telling you that Hale and at least 2 other administrative figures at Hargrove are under active investigation for their role in a scheme that has resulted in 4 deaths and significant public infrastructure damage. When people in that position become aware that the investigation is closing in, their behavior toward key witnesses becomes less predictable. I've been in less predictable situations. I know you have, he said. That's why I called you. He reached into the folder and put a card on the table, plain white, Fort Delaney letterhead, a phone number, and beneath it a name. Captain Lena Marsh, 5th Medical Brigade, Investigative Support. She'll contact you, Tran said. Don't go looking for her. Don't tell anyone at Hargrove about this conversation. Keep doing your job exactly as you have been, but document everything now, not just clinical, anything administrative you have access to, any conversations about your reports, your reassignment, your protocol violations. Sera picked up the card. And if Hale escalates before Marsh makes contact? Tran's expression didn't change. Use your judgment, he said. You always have. He left $40 on the table for a coffee neither of them had touched and walked out. She went back to Hargrove that morning expecting the administrative leave notice to be waiting for her, and it was a formal letter in an envelope at the nursing station, with HR's logo on the upper left corner, and her name typed in the kind of institutional font that communicated consequence. The review was scheduled for Friday. Until then, she was to report to her assigned ward and perform no clinical functions outside the scope of observation, beds 41 to 48. She signed the acknowledgement form without comment, folded the letter, and put it in her locker next to the notebook. Then she went to work. The observation ward was as quiet as it had been the day before, which was both a relief and a slow pressure. She did her rounds carefully, methodically, with the particular attention she would have given to any patient regardless of acuity, because low acuity was a classification, not a guarantee, and she'd seen stable patients become unstable inside of 6 minutes more times than she could count. She checked vital trends instead of single readings. She noticed small deviations. She updated charts with the kind of specificity that other nurses sometimes called excessive, and she called basic. By mid-morning, Linda appeared beside her at the Bed 43 nursing station, carrying a stack of supply manifests with the casual air of someone doing routine rounds. "You've got a visitor," Linda said, without looking at her. "A visitor." "Administrative. Came in through HR, name's Holloway. He said he's from City Regulatory Compliance, doing a routine hospital audit." Sera filed a chart note without pausing. "What kind of audit?" "Procurement records, supply chain documentation." Linda set the manifest down, still not looking at Sera. He specifically asked the charge nurse which staff members had filed internal supply chain discrepancy reports in the past 24 months. There it was. Not trans investigator. That would have come differently, quietly, through channels that didn't announce themselves. This was the other direction, someone checking to see what she knew. Someone who had learned that the investigation existed and was trying to determine how exposed they were. "Did they give him the files?" Sera asked. "Not yet. HR is running it through legal review first, which takes 48 hours minimum." Linda picked up her manifests. "Routine audit policy." "How did you know to tell me?" Linda paused for one beat. Just one. "Because he asked specifically about reports filed by nursing staff," she said. "Not pharmacy. Not logistics. Nursing." She tucked the manifests under her arm. "I've been a charge nurse for 11 years. Regulatory auditors don't start with nursing staff. They start with procurement. If they're starting with nursing, they're looking for something specific." She walked away. Sera watched her go. Linda Park was not a woman who took risks carelessly. The fact that she'd said this much meant she'd been thinking about it for long enough to decide the risk was worth it. Sera went back to her charts. She worked through the morning with the kind of surface calm that was a trained behavior, not a feeling. Underneath it, she was cataloging. Every administrative interaction she could remember from the past 18 months. Every time her reports had been acknowledged and then quietly buried. Every meeting where Hale had been present and where the conversation had shifted just slightly when Sera's clinical observations came up. The subtle change in register. The way the discussion moved away from the specifics and toward generalities about scope of practice. At 11:40, she went to the bathroom on the second floor. Not the one on the observation level, but the one near the administrative suite. The one with the window that looked out over the parking structure. She stood at the sink and ran cold water over her wrists the way she did when she needed to think without her hands doing anything else. Through the frosted window, she could see the parking structure. Third level. A dark blue sedan that hadn't been there yesterday, parked near the stairwell exit in the way that people parked when they wanted to leave quickly. Colorado plates, but the front plate was on a slight angle. Not crooked enough to be an accident, just enough to partially obscure the first two characters. She dried her hands. She went back to work. The man who called himself Holloway found her at 1:15 p.m. She was in the corridor outside Bed 46 when he appeared. Average height, late 40s, in a charcoal blazer over an open collar with a city regulatory badge clipped to his breast pocket. He had the practiced ease of someone accustomed to moving through institutional spaces without being questioned, and he smiled in the way that people smiled when the smile was a professional tool. "Ms. Voss?" he said. "Nurse Voss," she said. "Of course. I'm Tom Holloway, City Compliance Office. Do you have a few minutes? I'm on shift. This won't take long." He had a tablet in his hand, not a city-issued one, she noticed, but a commercial device with a protective case that had a small scuff on the lower left corner. "I'm reviewing supply chain documentation as part of a routine audit. I understand you filed some reports related to inventory discrepancies a while back." 18 months ago, she said. 2 reports. Both were filed through the hospital's internal clinical safety system. Right. He was already typing something on the tablet. "Do you still have copies of those reports?" "The hospital has the originals." "Of course. But sometimes nurses keep personal copies. For reference." She looked at him steadily. I filed the reports through official channels and received acknowledgement both times. I don't maintain personal copies of hospital documentation. He nodded slowly, with the smile still in place. And the specific items you flagged, do you remember the details? Part numbers, storage locations, anything like that? She had memorized every detail of those reports at the time of filing and had not forgotten them since. She had the kind of memory that came from years of needing to hold complex life or death information in her head in conditions where writing things down wasn't possible. I'd refer you to the filed reports, she said. Of course. He typed something else. And in the months since you filed those reports, have you noticed anything else? Any other discrepancies? Anything that seemed out of place in the supply chain or procurement side? He was good. The question was framed as casual, as routine, as a logical extension of what came before. If she didn't know what she knew, she might have answered it. I'm an observation ward nurse, she said. I don't have procurement access. He looked up from his tablet. The smile was still there, but something behind it had recalibrated. A slight sharpening, barely perceptible. The kind of adjustment that happened when a person realized they weren't going to get what they came for the easy way. Right, he said. Of course. Thank you for your time, Miss Nurse Voss. He walked back down the corridor, and she watched him go with her hands in her pockets and the steady, collected stillness of someone who had been interrogated before. Not in offices, not with tablets and compliance badges, but in other ways, in other contexts, and had learned that the most important thing you communicated in those situations was not information. It was the absence of fear. She went back to 46 and finished her round. At 3:30, a new patient came into the observation ward. Routine intake. A man in his late 40s transferred from the ER after a cardiac event that had been ruled non-STEMI but needed overnight observation. His name was Douglas Farr. He had the ruddy face and thick hands of someone who worked outdoors, and he arrived in a wheelchair pushed by a transport aide with the resigned expression of a man who hadn't expected to spend his Tuesday in a hospital. Sera did his intake. Blood pressure, pulse ox, medication history, current complaint. She noted the morning's labs. Troponin mildly elevated, trending down, which was consistent with the ER's working diagnosis. She was reviewing his medication list when she stopped. Farr was on 3 routine cardiac medications: aspirin, a statin, a beta blocker, standard. But at the bottom of the ER handoff sheet, listed under home medications patient reported verbally, was a 4th drug, a blood thinner, a specific type, with a dosage annotation that included a handwritten note prescribed by Dr. R. Osfield, Aldervane Medical Partners. She read the name twice. Aldervane, not Industrial Solutions. Medical Partners, a different entity, but the same root name. She kept her face neutral. She asked Farr the standard follow-up questions, confirmed his medication schedule, made sure his IV line was running correctly, and left him with the call button and a water pitcher and the television on a channel he said he didn't care about, but didn't ask her to change. In the corridor, she stood still for 10 seconds. Then she went to the nurse's station and pulled up Hargrove's provider directory, which was accessible from any clinical terminal. There was no Dr. R. Osfield listed in the Colorado Medical Board's online database. She checked the secondary terminal, which had external web access, using the search she'd done 100 times for patient medication verification. There was no Aldervane Medical Partners registered with the Colorado Secretary of State's office. She looked at the name on the handoff sheet again. Farr had been given a prescription by a physician associated with an entity that didn't exist, for a blood thinner at a dosage that was, she calculated quickly, roughly 20% higher than the standard therapeutic range for a man of his weight and age, in the context of a non-STEMI presentation that had just been through the ER with elevated troponin. Excess anticoagulation in a cardiac patient with active troponin elevation was not a routine concern. It was a bleeding risk. She went back to Farr's room. "Mr. Farr," she said, "when did you last take your blood thinner?" He thought about it. "This morning, 6, maybe 6:30. "How long have you been on it?" 3 weeks. New prescription. The doctor said it was to prevent clots with my heart history." "And this doctor, Dr. Osfield, where is his office?" Farr frowned. "That's the thing. It was one of those mobile health things. Pop-up clinic, they called it. Over on the south side near the docks. I went in for a blood pressure check and he said my chart showed I needed the blood thinner. Near the docks. 3 blocks from the Brannock warehouse. She kept her expression steady and professional. I'm going to check in with the attending about your medication list, she said. Standard procedure when someone transfers from the ER. Sure, Farr said. Is something wrong? Just being thorough, she said. She found Dr. Spill, her least favorite attending, who had filed the protocol report on her 2 days ago, at the end of the observation corridor reviewing charts. She didn't have the luxury of avoiding him. The patient in 46, she said, non-STEMI transfer. He's on an anticoagulant prescribed by a Dr. Osfield at Aldervane Medical Partners. The name doesn't pull in the board database, and the dosage is above therapeutic range for his profile. Spill looked up slowly. You ran a board search on a patient medication? I do it routinely for any medication I can't verify. She held his gaze. He's on an elevated dose of an anticoagulant with recent troponin elevation. That's a bleeding risk. Spill stared at her for a moment with the specific expression of a man whose relationship with her had been complicated by events she'd been right about, and he'd preferred she hadn't been. I'll review his chart, he said. Today, she said. Not end of shift. He held the look for a long beat. I heard you, he said. She walked away. 40 minutes later, she heard him order a coagulation panel on Farr and place a call to pharmacy for an anticoagulant review. She heard him ask the ward clerk to pull the ER handoff sheet, heard the brief silence when he saw the Aldervane name, heard him get on the phone with someone who clearly required more explanation than a 1-minute call. She documented her observation and her verbal report to the attending in Farr's chart, with timestamps. The notebook came out during her break. She wrote the name Aldervane Medical Partners in her tight handwriting, with the date and Farr's initials, and the prescription details, and the location Farr had described, south side near the docks. Then she added 2 words beneath it, same route. Because if Aldervane Industrial Solutions had diverted components from Hargrove's supply chain to falsify infrastructure work at the Brannock warehouse, and Aldervane Medical Partners was prescribing incorrectly dosed medications to patients in the same district through a pop-up clinic with no verifiable credentials, these were not separate problems. They were the same problem, operating in multiple systems at once, using the hospital, its supply chain, its geographic proximity, its institutional legitimacy, as both a resource and a shield. She put the notebook away. She thought about Tron's words, a pattern, and it ends in Mill Haven. She hadn't understood the scope of it yesterday. She was beginning to understand it now, Shatin. Her shift ended at 7. She was in the locker room when Captain Lena Marsh found her. Marsh came through the door with a visitor's badge on a lanyard and the compact efficiency of someone who had been moving through institutional spaces all day and was very good at it. She was younger than Sera had expected, early 30s, with dark eyes and the close-cropped practical hair of someone whose job required it. She didn't introduce herself. She sat down on the bench across from Sera's locker and waited until the 2 other nurses in the room had left. Then, "You had a conversation with a man named Holloway this afternoon." "I know who you are," Sera said. Marsh nodded once. "Then I'll skip the setup. Holloway is connected to the Aldervane network. He's not city compliance. That badge is fabricated. We've been tracking him for 6 weeks. The fact that he came directly to you means someone in this hospital told him about your reports." Sera sat down. "Hale. Or someone above Hale. We're not certain of her full role yet." Marsh put her hands on her knees. "You found the medication connection this afternoon. Farr in 46. We know about Aldervane Medical Partners. The pop-up clinics. There are 3 in Mill Haven's South District. They've been running for 8 months. We've traced 17 patients who receive prescriptions through them that don't correspond to any board-registered physician." "What are they doing with the prescriptions?" "Some of them are for drugs that generate significant insurance billing. Others—" Marsh paused, and the pause had a different quality than Tron's pauses. Less strategic, more like someone selecting language carefully. Others were still tracing. The anticoagulant Farr received is one of a group of medications that have appeared across multiple Aldervane patients with cardiac histories. We don't yet know if the overcalibration is intentional. Sera looked at her. "You think they're harming patients deliberately," she said. We think it's possible that some patients are being destabilized for purposes that benefit the network financially. We're not ready to say that definitively. Marsh met her gaze. Which is why we need documentation from inside the hospital, not just the supply chain, the clinical side. The pattern of which patients come through with Aldervein prescriptions, which physicians manage their care, what happens to their charts afterward. You need me to gather evidence while a man who's already been inside this hospital knows I filed the original reports. Holloway knows you filed reports. He doesn't know what's in them. He knows I'm a risk. Yes, Marsh said. He does. Sera put her street shoes on and tied the laces. Old hands, steady hands. The review on Friday, she said. Hale and HR are convening it. If the timeline accelerates on their end, we can move before Friday if we need to, but we need 48 hours. Marsh stood. Can you stay inside and operational for 48 hours? Sera looked at her. 8 years. 4 years of quiet. 2 days of the world deciding it wasn't done with her yet. She thought about Okafor bleeding quietly in bed 11 while everyone looked at the louder patients. She thought about the man from the warehouse who'd made it to OR because someone had recognized a herniation pattern in the 3 minutes before it became irreversible. She thought about Farr in 46, on an anticoagulant no one had questioned because it had been listed at the bottom of a handoff sheet. She thought about the notebook in her locker with its tight handwriting that no one had bothered to read. 48 hours, she said. Yes. And then what? Marsh reached for the door. Then the people who've been using this hospital as a resource and counting on everyone inside it to stay in their lanes find out that not everyone does. She left. Sera sat alone in the locker room for a moment. Then she picked up her bag, closed her locker, and walked out. She was almost to the stairwell when she heard it, from the direction of Trauma 2, 40 feet down the hall, a sound that she had learned to recognize the way some people recognized music. Not an alarm, not a code tone. Something earlier than that. The specific silence that came after a monitor changed and before anyone had registered it. She stopped walking, turned, pushed through the trauma bay door before she'd consciously decided to. The bay was occupied. A new patient, post-arrival, still being assessed by a resident she didn't recognize. Young, 3rd year maybe, with the concentrated look of someone moving through a protocol. The patient was female, 50s, trauma mechanism listed on the incoming board as a fall with loss of consciousness. The resident was focused on the head. Correctly, loss of consciousness warranted it. But Sera was looking at the abdomen, the way it sat, the slight asymmetry, the patient's right hand resting with its fingers curled inward, guarding without knowing she was guarding. "What's her blood pressure on arrival?" Sera asked. The resident looked up, registered her badge, registered the observation ward designation. "She's not your patient," he said. "What was her pressure on arrival?" Sera asked again. He hesitated. 96/62. "And now?" He glanced at the monitor. Something shifted in his face. 88 over... "Get a fast on her abdomen," Sera said. "Now. She's not protecting a head injury. She's guarding. Her pressure's dropping, and she came in from a fall that probably wasn't a fall." The resident stared at her. The monitor changed. The sound it made was not an alarm. It was the precursor. The slight flatness in the waveform, the rhythm beginning to lose its architecture. It was the sound that came 9 seconds before the alarm, if you knew what to listen for. "Now," Sera said. And she stepped forward into the bay, and the resident didn't stop her, and the monitor continued its quiet deterioration in the space between one breath and the next. And outside the door, somewhere in the building, something else was already moving. Not a patient, not a clinical event, but a different kind of change, the kind that came when a system's exposure reached a threshold and the people inside it stopped managing their exposure and started managing their survival. Holloway had not left the building. She'd seen the blue sedan still on the 3rd level of the parking structure when she'd passed the window at 6:45. He was waiting for something, and she was the only person in the building who knew it. The resident's name was Dr. Cole Abner, and he made the right call. He didn't argue. He didn't demand to see her assignment sheet or explain why she was in a bay she had no documented reason to be in. He looked at the monitor waveform, looked at the patient's abdomen the way Sera had indicated, and reached for the portable ultrasound without another word. That single decision, the willingness to set aside the hierarchy question and respond to the clinical one, told her something useful about him that she filed away without comment. The patient was a woman named Ruth Solis, 56, brought in by her neighbor who had found her at the bottom of her back porch steps. Neighbor said she fell. Neighbor wasn't certain because she'd heard the sound and not seen it happen. The ER had triaged her as a moderate head injury with altered consciousness, which was reasonable given the mechanism and the presentation. What the triage hadn't accounted for was the neighbor's second detail, buried in the bottom of the intake notes. Ruth Solis had been standing at the top of the steps carrying a bag of groceries. A fall carrying weight went differently than an unloaded fall. The body twisted to protect the load, which meant the impact distributed differently, which meant internal forces that looked like nothing on the outside could be significant on the inside. Abner ran the fast probe over the right upper quadrant. The screen showed fluid, not a trace, volume, a crescent of free fluid between the liver and the kidney that had no business being there. Hepatic laceration, Sera said. Abner was already on the phone before she finished the word. She heard him call for a trauma surgery consult and bumped the patient's priority, heard the slight controlled urgency in his voice that meant he'd registered what he was looking at, and understood that the next 15 minutes mattered. She stepped back. Her job in this room was done. She'd seen it, flagged it, confirmed it. What happened next belonged to people who were authorized to make it happen, and she needed to not be standing in a trauma bay she had no business being in when the attending arrived. She was in the corridor when Abner came after her. "Hey," he said. "Wait." She turned. He was young, 27, maybe 28, with the kind of face that hadn't finished settling into its adult version yet. He looked at her with something that wasn't quite gratitude and wasn't quite confusion, something between them. "How did you see that from the door, Ling?" he asked. "The way she was holding her right hand," Sera said, "involuntary guarding, and the pressure trend." "I had the pressure trend." "You were looking at her head." He held the look for a moment. "You're not supposed to be in trauma." "No," she said. "I'm not." She walked back to the stairwell. Outside, the parking structure was still there. Blue sedan, third level. The front plate still at its slight angle, the first two characters still obscured. She didn't go to her car. She went to the ground floor maintenance corridor that ran beneath the parking structure, through a door that required a staff keycard. Hers still worked, because whoever had processed her reassignment to observation had thought to revoke her trauma bay access, but hadn't thought through the ancillary systems. She walked the length of the corridor to the point where it passed beneath the structure's second level, then took the internal stairwell up. She wasn't sure what she was doing exactly. That was honest. She had a rational reason. She needed to know if Holloway was still there, needed to know whether his presence meant active surveillance or simple waiting. But underneath the rational reason was something older and less articulable, a refusal to be watched from a distance by someone who had already come into her space and asked questions designed to assess her threat level. She had spent 8 years in environments where information asymmetry was a survival variable. She did not enjoy being on the wrong side of it. The third level was mostly empty at this hour. 7 vehicles spread across 40 spaces. The blue sedan was backed into a spot near the stairwell exit, engine off, no movement visible through the rear window. She came out of the stairwell on the far end of the level, away from the sedan, and moved along the outer wall where the structure was open to the air and the sodium lights didn't quite reach. The cold hit her without the building's heat to buffer it. She moved the way she'd learned to move in places where moving wrong had consequences. Low center of gravity, weight distributed, no sound from her feet on the concrete. She got close enough to see through the sedan's side window. Holloway was in the driver's seat, phone in his left hand, the screen lit. He wasn't watching the hospital entrance. He was reading something, a document, from the look of the screen layout. His right hand was on the wheel but relaxed. Not surveillance posture, waiting posture. He was waiting for a call or a message, not watching for movement. She stood still and considered what that meant. If he were surveillance, he'd be facing the building. He wasn't, which meant his information wasn't coming from watching the entrance. It was coming from inside. From inside. She went back the way she'd come. Linda Park was still on the floor when Sera found her, which was unusual. Linda's shift had technically ended at 6, and it was now past 7:30. She was at the charge station, finishing documentation with the focused expression of someone who had added an hour to her day because the day required it. Sera sat down beside her at the station. "Who has access to the nursing staff report files?" she said, quietly, without preamble. Linda didn't look up from her screen. "Clinical governance, HR, the medical director's office. And Hale. Hale's office sits under the medical director. So yes." A pause. "Why?" "The man who came to talk to me today, Holloway. He knew about my specific reports. Not just that I'd filed them, the subject matter, the supply chain discrepancies, the inventory items." Linda stopped typing. "That's in a restricted file," she said. "I know." A long moment. The station was quiet around them, just the low hum of the building settling into its night register. "Hale had a 30-minute meeting with someone from City Compliance last month," Linda said, carefully. "I saw it on the floor calendar before it was removed. It was listed as a routine audit meeting. Last month. The 15th. Sera did the timeline in her head. 6 weeks ago, Marsh had said they'd been tracking Holloway. 5 weeks before his visit here. If he'd been in contact with Hale a month ago, the information pipeline from the restricted files to the Aldervane network had been running for at least that long. Possibly longer. "I need to know if anyone accessed my personnel file in the past 6 weeks," she said. "I can't get you that. HR access logs? I know you can't get it officially," Sera said. "I'm not asking you to do anything that creates risk for you, Linda. I'm asking if you have any knowledge of it." Linda was quiet for a long moment, the kind of quiet that had information inside it. "The week after the Okafor incident," Linda said, very carefully, "I was in the administrative corridor running a supply request through. Hale's office was open. I heard her on the phone. I wasn't listening. I was passing, but I heard a name." Sera waited. "Your name," Linda said, "and then something about records. That's all?" "That's all I heard." Linda looked at her for the first time since they'd sat down. Her eyes were steady and tired and carrying something that might have been the specific guilt of someone who'd known something wasn't right for a long time and had chosen the boundaries of their own exposure carefully. "I should have told you." "You're telling me now," Sera said. Linda looked back at her screen. "Be careful," she said. "Whatever this is, the people involved are not small." Sera stood. "I know." She was at the stairwell door when Linda's voice came after her one more time. "The woman in 47, Linda said, from 2 nights ago. She called the unit today to ask about you. Said she wanted to thank the nurse who kept checking her." Sera paused with her hand on the door. "She left her name," Linda said. "Patricia Wen. She said if you ever want to talk, she works at the Millhaven Courier. A journalist." "Of course." She filed it and pushed through the door. Yes. Thursday arrived with the particular quality of a day that knew what was coming. The sky over Millhaven was low and gray, carrying the kind of cold that made the city look harder than it was. And the hospital corridors had the compressed efficiency of a place running slightly over capacity with slightly under the staff it needed. Sera arrived at 6:50. She changed her shoes. She opened her locker. The notebook was where she'd left it. Except. She picked it up. Opened to the last pages. Nothing had been moved. Nothing had been removed. The tight handwriting was exactly as she'd left it, and the notebook had been closed at the same page. But the locker itself had been opened. She could tell because she'd been leaving it a specific way. A small piece of medical tape along the bottom hinge, flush with the metal, that would shift if the door were opened and not perfectly realigned. The tape was shifted, by less than 2 millimeters, but shifted. Someone had been in her locker. Not Holloway. He didn't have building access to the staff areas. Someone with a key card. Someone on the inside. She closed the locker, put the notebook in her scrub pocket, went to the nurse's station and started her shift like nothing had happened. But the math was changing. If they'd accessed her locker, they were past the information gathering phase. You didn't go into someone's personal space when you still thought you had time to manage the situation quietly. You went there when you were running out of quiet options. At 9 a.m., she called Marsh's number from the bathroom on the 2nd floor. 1 ring. "Status," Marsh said. "They're in my locker, sometime between last night and this morning. Nothing taken. I would have known. But they were looking." A pause. "That escalates our timeline." "I know. Who's running your end?" "We have 2 agents positioned outside. Building access is covered, but we need you inside until we've got full documentation on the Aldervane Hargrove link. If you leave prematurely, I'm not leaving, Sera said. I'm telling you the situation is moving faster than 48 hours. Another pause. Marsh was recalibrating. She could hear it. Can you get through today's shift without contact with Hale or administrative? My review is tomorrow morning. Can you avoid her until then? I've been assigned to observation. She has no reason to come to my floor. She thought about the blue sedan. But Holloway's still here. He spent last night in the parking structure. We know. We've had eyes on him since 5 a.m. A beat. He made a call at 6:40 this morning. We're working on the trace. Another beat. Voss, keep your head down today. No more trauma bays, no more unauthorized interventions. Tell that to the patients. Marsh's voice shifted. Not softer exactly, but different. I know what I'm asking you to do. Stay in your lane for 18 more hours, and we'll have enough to move. Sera ended the call. She went back to observation and kept her head down, which was not the same as doing nothing. She documented. She documented everything, every patient interaction, every medication verification, every time a supply request came through and the chain of custody had a gap in it. She was not a woman who could be in a building for 8 hours without paying attention, and attention produced documentation, and documentation had a way of becoming useful in ways you didn't always predict. At 11:15, Dr. Spill came to the observation station. She prepared herself for something administrative, another deviation report, or a preliminary notice about tomorrow's review. But what he said was not that. The patient in 46, he said. Far. Yes. His coagulation panel came back this morning. Spill's expression had something in it she hadn't seen before. Not exactly chastened, but rearranged. Like someone who had been looking at a picture from one angle and had just been shown what it looked like from another. His INR was 4.2. She kept her face neutral. An INR of 4.2 on a blood thinner meant his blood was nearly 4 times slower to clot than therapeutic target. In a patient with recent troponin elevation and active cardiac stress, that was not a medication error. That was a patient being set up to bleed. Did pharmacy review the prescription? She asked. They can't verify it. The prescribing entity doesn't exist in any database they can access. He paused. I contacted the medical board this morning. There's no Dr. R. Osfield licensed in Colorado. What about Aldervane Medical Partners? Spill looked at her. You already knew, he said. I told you yesterday, she said. The name didn't pull in the database. I thought it was a registration lag. Some of these telehealth groups. It's not a telehealth group. He was quiet for a moment. Around them, the ward continued its mid-morning routines. A food cart rattled past. An IV pump alarmed one room over and silenced itself. Farr is being transferred to cardiology, Spill said. They're going to hold the anticoagulant and do a full reversal protocol. He'll be fine. He paused again, and the pause had the weight of something he hadn't said yet. The other medication on his list, the statin. I cross-referenced it. 2 other patients in the past 3 months received prescriptions from the same prescriber. Both had hospital admissions. Both had adverse events that were attributed to underlying conditions. She looked at him. How did you find that? She said. I asked pharmacy to run a name search, he said. Osfield, across the past 12 months. He shifted his weight. Spill was not a man who admitted uncertainty easily. She'd watched him manage clinical ambiguity with the studied confidence of someone who'd decided that confidence was a component of competence. What she was seeing now was different. There are 11 patients, Voss. 11 patients at Hargrove in the past year who have had prescriptions from providers that can't be verified. 7 of them had adverse outcomes. 7 out of 11. She breathed. You need to report that to administration, she said. He looked at her with something that might have been rueful if he'd had the bandwidth for it. I went to Hale's office this morning. Her assistant said she was in an off-site meeting until this afternoon. He paused. I also tried the clinical governance line. Got voicemail. She looked at him steadily. Who else have you told? No one yet. He held her gaze. I'm telling you. Which told her something important. Spill was not a man who came to nurses with his clinical concerns. He came to other physicians, to department heads, to people in his tier or above it. The fact that he was standing in the observation ward corridor telling her, the nurse he'd filed a protocol violation against 2 days ago, meant that somewhere between the coagulation panel and the pharmacy search and the unanswered phones, he'd made an assessment. He'd assessed that she was the person who already knew what this was. I was right. Keep the pharmacy documentation, she said. The search results, the names, the adverse outcomes list. Don't send it through the hospital's internal system. Why not? She held his gaze for a moment. Decided. Because the internal system is compromised, she said. And whoever compromised it already knows you went to pharmacy this morning. The color shifted in his face. Not dramatically. He was a physician with 30 years of keeping his expression managed. But the shift was real. You're saying this goes above Hale, he said. I'm saying protect the documentation. Keep a copy off network. She paused. And avoid Hale's office for the rest of today. He stared at her for a long moment. There was a question behind his eyes, not about the clinical facts, which he was clearly already processing, but about her. About the gap between a nurse assigned to observation and a person who had just told him, with total calm, that the hospital's internal reporting system was compromised and that he should stay away from the department head. He didn't ask the question. He nodded once and walked away. She watched him go and thought, 11 patients, 7 adverse outcomes, 12 months of invisible harm running through a hospital that everyone believed was a place of repair. Her phone buzzed. Not her cell. The pager. Marcia's number, a text code, 2 hours. Move up. 18 hours had just become 2. She kept working. This was the thing that people who hadn't been in the military rarely understood about high-stakes situations. The waiting was not downtime. The waiting was the hardest part of the work, because it required you to function at full capacity inside a normal framework while carrying the weight of the non-normal thing, and it required you to do this without leaking, without letting the non-normal thing change your face or your pace or the way you answered a call light. She checked 41. She updated 43's discharge paperwork. She answered questions from a family visiting the patient in 44 with the same patience she'd have given them on an ordinary Thursday. At 1:15, Abner appeared in the observation corridor. He was still in his scrubs from the night before, which meant he'd either pulled a double or come back early, and he had the slightly hollowed look of someone who had been running on adrenaline for too long and was starting to feel the edge. Solis made it through surgery, he said. She's in the ICU. Grade 2 laceration. They repaired it. Good, Sera said. She would have coded in the bay. He said it without drama, as a statement of fact. If you hadn't walked in, you made the right calls once you had the information. Because you gave it to me. He stopped walking. I looked you up this morning, your file. He paused. It doesn't say anything about why you were reassigned to observation, just that you were. She looked at him. And, she said, and Spill's deviation report is in there, the one from the Okafor case. He met her eyes. Okafor was discharged this morning. I saw him in the elevator. He was walking under his own power. She said nothing. I talked to Webb, Abner said, about the warehouse patient. He said the same thing. The Cushing's identification was, he stopped again, searching for a word that wasn't clinical. He said it was the kind of thing you learn in conditions where getting it wrong had consequences that couldn't be walked back. Webb talks too much, she said. Maybe. Abner looked at her with the particular directness of a young man who hadn't yet learned to be indirect about things that mattered to him. I just wanted you to know that I saw it. What you did. Both times. She looked at him for a moment. Keep your eyes on your patients, she said. That's all you need to do right now. He nodded. He went back to the trauma corridor. She turned back to her work and checked the time, 1:24 p.m. 40 minutes later, the fire alarm went off. Not the building alarm, the localized alarm from the second-floor administrative wing, which had a different tone than the floor alarms, a slightly higher pitch that Sera had learned to distinguish in her first week simply because distinguishing alarms was something she did automatically. The kind of alarm that indicated heat detection, not smoke, which meant an accelerant event or an electrical fault rather than a spreading fire. The administrative wing, where Hale's office was, where the clinical governance files were stored, where the procurement records and the nursing staff report files lived in a server room at the end of the hall. She was already moving when the PA came on. She took the stairs to the second floor, not running, not walking, the controlled fast pace that covered ground without announcing itself, and pushed through the fire door into the administrative corridor. The smoke was coming from the server room. Not a large fire, a deliberate one, small, concentrated, targeted at the 2 filing cabinets and the server rack in the far corner. the kind of fire that was designed to destroy specific things and leave the surrounding structure intact enough that it looked like an electrical fault. She had the hallway extinguisher off the wall mount before she'd consciously decided to move. 12 feet. The server rack was the priority. The paper files were already significantly damaged, and paper burned faster than she could stop it, but the server's hard drives had a better chance if she could get the temperature down before the motherboard failed. She hit the base of the fire with the extinguisher, sweeping low, following the chemical cloud into the corner, and the fire came down in 40 seconds. Not out. Stubborn residual burning in the paper, which she addressed in 2 more passes, but contained and dying. The smoke hung in the room. She stood in it with the extinguisher at her side and looked at what was left. The paper files were gone. 2 full drawers of documents, not random documents. She could see the tab labels on the ones at the edges of the burn zone. Clinical Governance Reports 2022-2024, and Staff Incident Documentation, her reports, and every other clinical safety report filed by nursing staff in the past 2 years. Gone. The server rack was damaged but possibly recoverable. She'd gotten to it before the heat sustained long enough to fully compromise the drives. Maybe. 8 would have to make that call. She heard footsteps in the corridor. Security first, then a maintenance supervisor, then, moving faster than the others, arriving from the direction of the elevator, Hale. Hale stopped in the doorway. She looked at the room. She looked at Sera standing in it with the extinguisher. Her face did something complicated. Not horror, not relief. Something that moved through several registers in a single second and settled on an expression that was careful and unreadable and just slightly off. The expression of someone who was looking at a situation that had not gone the way it was supposed to go. "How did you know to come here, Mom?" Hale said. "I heard the alarm," Sera said. "You're assigned to observation." "The alarm was on this floor." Sera set the extinguisher down. "I used the nearest fire suppression available. That's emergency response protocol." Hale's gaze moved from her to the server rack, to the paper files, back to Sera. "Is anyone else here?" Hale asked. It was a strange question. Security was in the corridor. Maintenance was behind her. There were clearly people present. She was asking if anyone else had been in the room before Sera. "I was first on scene," Sera said. Something moved through Hale's expression. Quick, controlled. "All right," she said. "Security will need a statement." "Of course," Sera said. She gave the statement. Concisely, accurately, with the particular calibrated specificity of someone who understood that every word she said in this room was evidence in something larger than a fire report. When the security officer was done, she walked back toward the stairwell. She was 3 steps from the door when her phone buzzed. A text from Marsh's number. Not a code this time. "Don't go back to your ward, north parking exit, now." She changed direction without breaking stride. The north exit came out on the side street behind the hospital, away from the main entrance and the parking structure. She pushed through it into the cold air, and Marsh was already there, in a dark green coat, standing beside a vehicle that was not her own, with 2 other people who were not in uniform but carried themselves in a way that made uniform irrelevant. "The fire," Marsh said. "Server room, 2nd floor, clinical governance files. I contained it. The paper documents are gone, but the server drives may be recoverable." Marsh looked at the person beside her. A man, 40s, with the particular stillness of someone who processed information faster than he reacted to it. "Get someone in there before hospital IT touches the drives," she said to him. He was already on his phone. Marsh turned back to Sera. "Holloway left the parking structure at 12:58. We lost him for 4 minutes in the south lot." 4 minutes. Enough time to get to the 2nd floor via the service stairwell, set an accelerant in the server room, and leave. "He was burning the evidence," Sera said. "They knew about the investigation." "We think there's a leak on our end," Marsh said. Her jaw was tight. "Someone in the municipal liaison network. We don't know who yet." The cold was significant now, the kind that came in off the Rockies, and didn't care about coats. "What do you need from me?" Sera said. "The notebook," Marsh said. Sera reached into her scrub pocket. She held it out. Marsh took it. She didn't open it, just held it and looked at Sera with an expression that had something in it beyond the professional. "The drives are our best evidence if they're recoverable," Marsh said. "But if they're not..." Your documentation is the only remaining record of the supply chain reports and their timeline. Do you understand what that means? It means I'm the evidence, Sera said. Yes. Marsh held her gaze. And it means they know it too. Somewhere behind the hospital, a door slammed. All four of them turned. The north stairwell door, the service stairwell, the one Holloway would have used, was swinging closed. Someone had just come through it. The man with Marsh moved first, around the corner of the building, fast and silent, in the way of someone who'd done this before. The second agent split left. Marsh stepped in front of Sera. 10 seconds of silence that had edges. Then the man came back around the corner. He was not alone. He was holding Holloway by the upper arm, and Holloway was not struggling, not speaking, but looking at Sera with an expression that she recognized from a particular category of encounter she had spent years learning to read. The expression of someone who has run the calculation and arrived at a number they don't like but have accepted. Marsh exhaled. Holloway's gaze stayed on Sera. You were in the parking structure last night, he said. It wasn't a question. Third level. You came through the maintenance corridor. She said nothing. I want to know, he said, still looking at her, how long you've been running ahead of this. Long enough, she said. He nodded slowly. Something in his expression shifted. Not respect exactly, but the functional equivalent that people arrived at when they'd been outpaced by someone they'd underestimated. Marsh was already coordinating on her radio, and the logistics of what came next were beginning to assemble around them. Other vehicles arriving, other people, the particular machinery of an official action that had reached its point of execution. And then Marsh's radio crackled. Not her coordination channel. The hospital's emergency frequency, which she was monitoring in parallel. The voice on it was the hospital operator, clipped and urgent. Code Blue, OR3. Repeat. Code Blue, OR3. Cardiac event, patient on table. All available surgical personnel. Marsh looked at Sera. Because Marsh had read enough of Voss's file to know one thing that the radio announcement didn't yet say, that OR3 was running an emergency surgery on a patient transferred from the Brannock warehouse incident, one of the 11 men still in critical condition from the collapse. One of the men whose case had been assigned, per the surgical schedule posted at 6 a.m., to Dr. Warren Bask. And Bask was not responding to his radio. His last known location, per security, was the second-floor administrative corridor, where the fire had been. Where he'd been going, according to the maintenance supervisor's account, to meet with Hale about an urgent administrative matter that had been scheduled with 30 minutes' notice at noon. The radio crackled again. Unable to locate attending surgical staff for OR3. Repeat, patient in cardiac arrest on table, no attending present. Marsh was already turning. But Sera was already moving back toward the hospital door, because the math was simple and brutal, and she didn't need anyone to explain it to her. A patient was dying in an operating room, the attending was missing, and she was standing 20 feet from the entrance of a building where she had spent 4 years being told she was not enough. She went through the north stairwell door at a controlled run. Not sprinting. Sprinting in a hospital was how you arrived somewhere out of breath, and with your hands shaking, and she needed neither. The pace she used was the one she'd learned in the years before this one. The pace that covered ground efficiently without costing you the precision you needed when you got there. 4 flights. She hit the OR level door with her shoulder and pushed through into the scrub corridor. The sound from OR3 reached her before she could see the room. Not chaos, controlled urgency, which was worse in some ways because controlled urgency meant the people inside had already moved past the moment of shock and were managing the thing, but managing it without the piece they needed, which was someone who could make the calls that changed the trajectory. She hit the scrub sink running, 3-minute protocol compressed to 90 seconds of cold reality, and pushed backward through the OR door with her elbows. The room had 4 people in it. A scrub tech named Dario Selt, who had 9 years on surgical floors, and the specific unflappable quality of someone who had seen enough to stop being surprised and start being useful. A circulating nurse, Bev Caro, who was on the phone with someone who clearly wasn't answering. An anesthesiologist, Dr. Una Pak, who was managing the airway with the concentrated stillness of a person doing several things at once and succeeding at most of them. And a second-year surgical resident named Dr. Tomas Reyes, who was standing at the patient's open chest with his hands in a position that meant he had not moved them in at least 2 minutes, which was 2 minutes too long. The patient was Marcus Tully, 44, one of the Brannock warehouse workers. His chart, which Sera had never seen but which she read in the time it took to cross the room, told her what she needed. Emergency thoracotomy for a delayed hemothorax that had been managed conservatively for 48 hours before decompensating this morning. Bask had opened the chest 30 minutes ago. The bleeding had been controlled, and then something had gone wrong with the rhythm. Not the repair, from the look of the field, but a stress arrhythmia that had escalated to ventricular fibrillation while the chest was still open. They had defibrillated twice. Pack had it noted on the anesthesia board: VF at 1403, shock at 1404, no conversion, shock at 1406, no conversion. Current rhythm on the monitor, fine, VF. The heart was fibrillating, but not strongly, a pattern that meant the myocardium was exhausted, and every minute without conversion reduced the chances that it would convert at all. "Where's Bask?" she said. "Missing," Reyes said. His voice was controlled but thin. "We've been calling for 8 minutes. Who's the backup attending?" "Ruiz is in OR1. They're trying to pull her, but she's mid-repair and can't leave." Sera stepped to the field. Pack looked up at her. She was 41, Korean-American, with dark eyes that took in the world with the specific economy of someone who processed information fast and talked about it slowly. "You're the observation nurse," Pack said. "I am," Sera said. "You came from where?" "Outside." She looked at the field, at Reyes, at the monitor. "How long since the second shock?" 4 minutes, Pack said. "Epinephrine?" 1 milligram at 1407, no response. "Amiodarone?" "Loading dose at 1408. We're at 2 minutes post-infusion." She looked at Reyes. I was looking back at her with the expression of someone who had been trained for this moment, theoretically, and had arrived at it practically, and discovered that the gap between those two states was significant. "Internal massage," she said. "You need to maintain perfusion while the amiodarone works." "Do you know how?" Yes, I know how. I know." She positioned herself across the table from him. "I'm going to talk you through it. You're going to do it. Start now." Reyes put his hands in. She talked. Not the way a textbook talked, in structures and sequences and terminology that had to be translated before it meant anything. The way a person talked who had done this before, in conditions that made this look manageable, with less equipment and more variables, and the absolute knowledge that there was no one coming to take over. She gave him the rate, the depth, the positioning, the feedback loop, the feel of it, which you couldn't get from diagrams, the specific resistance of cardiac muscle under compression, and what change in that resistance told you. Reyes's hands found it inside 40 seconds. Not perfectly, not with the automatic fluency that came from repetition, but correctly. The right position, the right rhythm, the right force, and more importantly, the right response to feedback. He was a good resident. She could tell that now the way she'd been able to tell Abner was a good resident, not from credentials or reputation, but from the specific way he responded when the situation pushed back. The monitor showed organized activity at the 2-minute mark, not conversion. But the fine fibrillation had coarsened. The waveform was larger, which meant the myocardium was responding to the amiodarone and the perfusion, which meant the next shock had better conditions to work with. "Pack," Sera said. "Ready," Pack said. 200 joules. Hands clear. Reyes lifted. Pack delivered. The monitor went flat for 1 long second, then sinus rhythm, ragged, bradycardic, but sinus. The room exhaled. Not loudly. Not with celebration. The specific quiet exhale of people who had been holding something tight and were letting a fraction of it go while keeping the rest, because the patient was in conversion but not stable, in sinus but not safe, and the chest was still open and Bask was still missing. "We need to close," Reyes said. "Can you close?" He looked at the field. She could see him doing the assessment, not of his training, which he knew, but of the specific situation in front of him, which was a partially completed thoracotomy on a patient who had just been through 2 defibrillation attempts and 8 minutes of manual cardiac massage, and who needed to come off the table without dying. "I need guidance," he said. "You'll have it," she said. They worked. She did not touch the surgical field. That was a line she held deliberately and clearly, not because of the rule that prohibited it, The rule existed and she understood it, but because the rule existed for a reason. And the reason was that surgical procedures required a physician's hands and a physician's accountability, and she was providing the first without the second, and the distinction mattered. What she did was position herself where Reyes could see her face and hear her voice, and she told him what she saw and what it meant and what came next. Dario worked the instruments with the efficiency of someone who'd been in ORs long enough to anticipate rather than respond. Bev had gotten off the phone and was documenting with the focused speed of someone who understood that what was happening in this room was going to require a complete and accurate record. Pat kept the patient in anesthesia and watched the monitor with the sustained attention of someone managing 3 variables simultaneously and not dropping any of them. 22 minutes after Sera had walked through the door, Reyes placed the last suture. The chest was closed. Tully's rhythm was sinus, rate 71, blood pressure 84/56, and climbing. He was alive. The hallway outside OR3 was where everything else arrived. Ruiz came first, still in her OR gown from the room next door, having gotten word that something had broken wrong in 3. Behind her came 2 other attending surgeons who had been in the building on other cases. Behind them, moving through the corridor with a different quality of arrival, not hospital staff, not rushing, came Marsh and the man who had brought in Holloway, and a third person Sera didn't recognize in a dark jacket with a federal badge on his belt that he hadn't bothered to conceal. And behind all of them, being escorted by 2 uniformed officers from the Millhaven Police Department, came Hale. She was not in handcuffs. Not yet. She was being walked rather than led, and there was a legal distinction between those 2 things that Sera was certain Hale's attorney would spend considerable time on in the coming months. But she was being walked, and the officers were close, and she was not going anywhere she chose. Hale looked at Sera in the corridor. She looked at OR3's door, at Ruiz, at the federal badge back at Sera. Her expression, in that sequence of looks, completed a journey that Sera had watched begin in the server room, the complicated thing that had moved through several registers. It had arrived somewhere simpler now, not defeat, not contrition. The specific, stripped-down clarity of someone who had run the calculation and arrived at the final number. She looked like someone who had understood that it was over. She didn't speak. Sera didn't speak to her. Marsh reached Sera's side. "Tully?" "Alive," Sera said. "Sinus rhythm. Chest closed. He needs ICU overnight minimum." Marsh nodded. She looked at Sera with an expression that was doing the professional version of something more. "We found Basque," she said, quietly. "Where?" "Second floor administrative corridor. He was locked in the server room stairwell." Hale called him to a meeting. When he arrived, Holloway was there. Marsh paused. He wasn't harmed. Holloway locked him in and pulled the server room door to buy time. So Basque hadn't been complicit. He'd been neutralized. There was a difference, and it mattered. Not just legally, but in the specific accounting of the situation that Sera was still doing automatically, cataloging who had known what and when and whether they'd had a choice. "He's being interviewed now," Marsh said. Around them, the corridor was reorganizing. Ruiz was going back to her own patient. The other attendings were dispersing. The federal agent with the badge was on his phone, speaking quietly in the direction of the elevator bank. Reyes came out of OR3 with Dario and Bev behind him. He stopped when he saw Sera. He looked at her for a moment. He looked like someone who had just finished doing something they hadn't been certain they could do, and was still in the process of understanding that they'd done it. "We need to write this up," he said. "Yes," she said. "You're going to need to be in that documentation." "I know." He held her gaze. "What you did in there, the massage coaching, the conversion sequence, that's not observation ward nursing." "No," she said. "It's not." He looked like he had more to say. He didn't say it. Not yet. Not here. In the corridor with this much moving around them. But she could see the question behind his eyes that had been building since the moment she walked through that OR door. The same question Webb had asked. The same one Abner had circled around. The question could wait. They put her in a consultation room on the 3rd floor. Not under arrest, not under restriction. Marsh was specific about that. And the federal agent who introduced himself as Supervisory Agent Paul Dredd from the Colorado Division of the FBI's Financial Crimes Unit was specific about it too. They put her in the consultation room because they needed a statement, and they needed it in a space with a door and a table, and this was the nearest available one. Dredd was methodical. He went through everything chronologically. The supply chain reports, the Okafor intervention, the protocol violation, the reassignment, the Holloway visit, the locker, the FAR medication, the fire, the OR. He had a recorder and a pad, and he used both. And he asked the kind of questions that told her his preparation had been significant. He knew about the Aldervane network structure. He knew about the pop-up clinics. He knew about the falsified procurement and the gas system at Brannock. What he needed from her was the clinical piece, the documentation thread, the pattern she'd observed in real time over 4 years, the specific evidence that tied the hospital's administrative decisions to the network's operations. She gave it to him, all of it, in the same tight, specific way she'd have given a field debrief. Chronological, factual, without interpretation where interpretation wasn't needed, and with it where it was. It took 40 minutes. At the end, Dredd put his pen down and looked at her. "The notebook," he said. "The one you gave Captain Marsh." "Yes." "The supply chain report details in it. The part numbers, the storage locations, the chain of custody gaps. We've been trying to reconstruct that from the hospital's procurement records, which are partially corrupted. Your documentation is more complete." "I was thorough," she said. "You were." He looked at her for a moment. "In your assessment, how long had the diversion been running when you first identified it 18 months ago?" She had thought about this. Based on the inventory patterns, the accumulation of mislabeled items, the gap between listed quantities and physical counts, I'd estimate 12 to 18 months before my report. So the operation had been running for 2.5 to 3 years by the time I flagged it, which is consistent with Aldervane Industrial Solutions Incorporation date, Dredd said. He said it in the way of someone confirming rather than informing. "And with the Brannock gas system work order," she said. "Yes." He picked up his pen again, wrote something at the bottom of the pad. "We're going to need you available for the next several days, possibly the next several weeks. This will go to a federal grand jury." "I understand." He looked up. "Do you have legal representation?" "Not currently." "You should get some." He said it without alarm, without the weight of implication, just practically. "Not because you're in any jeopardy, you're not, but because you'll be a significant witness in a federal case, and witnesses in federal cases benefit from having counsel who can manage the process around them." She nodded. He closed his pad. "One more thing," he said. "Basque. In his interview, he mentioned that when he heard you'd been in OR3, his first reaction was that the situation must have been serious." She looked at him. He said, "And I'm telling you this because I think you should know." He said that in 31 years of surgery, he'd never been outpaced clinically by a floor nurse, and that if you were in that room, something had required you to be. Dredd's expression was neutral, but not without something. "He asked us to make sure you knew he said that." She sat with that for a moment. "Tell him the patient's in sinus rhythm," she said. She was in the consultation room for another 20 minutes after Dredd left, waiting for Marsh to return with paperwork that needed her signature. The room was small and had a window that looked out over the hospital's rear garden, a strip of grass and 3 benches that existed primarily because someone's planning document had required green space. No one was ever out there. It was too small to be useful and too visible to be private. She watched it while she waited. The thing about the past 72 hours was that they'd had the quality of something compressed, events that should have unfolded over weeks or months arriving in layered succession, each one overtaking the last before there was time to process it. She knew this feeling. She'd had it before, in contexts where the operational tempo was dictated by external events, and her job was to stay current with the tempo rather than behind it. What she didn't know yet was what came after. After was always the part that caught people. The operational phase had its own momentum, its own logic, its own demands that kept you functional and forward-facing. The after was quieter and required a different kind of resource. She'd been managing the after for 4 years. She thought she was reasonably good at it. But this particular after was going to be different, because it wasn't going to be quiet. Marsh came back at 4:10 with a 2-page document and a pen, and the expression of someone who had been managing multiple threads simultaneously and was keeping all of them moving by force of will. "Hale's been formally charged," she said, setting the document down. "Obstruction, fraudulent concealment, and criminal facilitation. The DA's office is coordinating with Dredd's team on the federal elements. Holloway? Federal custody. He's talking. Not fully. Not yet. But enough that we're starting to get the network's upper structure. There are people above Aldervane who've been running this across 3 states. Marsh paused. Brannock isn't the only building. There are 2 others in Colorado with falsified safety documentation, plus 4 in New Mexico and Arizona. 4 years. 3 states. 40-some people had been in that warehouse when it came down. 11 of them were still in hospitals. 4 were dead. The numbers had a weight that she sat with for a moment before setting aside, because sitting with weight indefinitely was not a skill that served anyone, and she had learned to put things in the appropriate place and return to them later, rather than carrying them in the foreground. She signed the document. "What about the server drives?" she asked. "IT Forensics is working on them. We'll know within 24 hours if the data is recoverable." Marsh picked up the signed pages. "The notebook's been formally entered into evidence. You'll get it back when the case closes." "Keep it," Sera said. "I remember everything in it." Marsh looked at her. "That's not standard witness management," she said. "I know." A beat. Marsh sat down across from her, which she hadn't done before. She'd been standing through most of their interactions, the posture of someone between tasks. Sitting meant something different. "The 5th Brigade," Marsh said. "Colonel Tran wants you to know that your service record has been flagged for the investigative support file. That's relevant to how your testimony is weighted in the federal case." "I'm a civilian witness." "You are," Marsh said, "but your background is going to come out in the case. The defense will try to characterize your actions, the interventions, the OR, all of it, as a pattern of a person who operates outside boundaries. We need to preempt that characterization." She paused. "Which means we need people to understand what you actually are." Sera looked at her steadily. "And what's that?" "Someone who spent 8 years being trained to save lives in conditions that would have immobilized most people," Marsh said, "and who spent 4 years doing it anyway, in a building that tried to make sure no one noticed." The room was quiet for a moment. "They noticed," Sera said. "They just decided it was inconvenient." Marsh nodded slowly. "That's going to be part of the record, too." She left. Sera sat alone in the consultation room for 10 minutes. She wasn't processing exactly. She was doing the thing she did when the operational phase ended and the quiet came back, which was simply allowing the sequence to settle into a form that she could carry without it running. Then she got up and went back to the observation ward. Because she still had patience. That was the thing that the afternoon had not changed. Ward 41 through 48 still had people in it who needed their vitals checked and their IV lines managed and their questions answered, and no one had officially changed her assignment, and so she went back to it. Linda was there when she arrived. She looked at Sera the way people looked at someone who had been through something visible and come back to the room. She didn't say anything immediately. She poured a cup of coffee from the nurse's station pot. Bad coffee, the end of the afternoon burnt coffee, and set it on the counter near Sera's assignment board. Sera picked it up. "Bev called from OR recovery," Linda said. "Tully's pressure is 90/60 and climbing." "Good." She also said Reyes hasn't left the floor. He's been sitting in the scrub corridor writing his OR report for 2 hours. Sera drank the coffee. It was bad. She didn't care. "The woman in 47 asked about you again," Linda said. "Patricia Wen. She's been discharged, but she left her card." The journalist. Sera set the coffee down. "I know, you told me." "You might want to think about that one," Linda said, carefully. "I know." She picked up her assignment board and went to check on 41. It was a fractured wrist, a 60-year-old man named Harold Gauss, who had fallen in his driveway and who had spent most of the day being cheerfully irritated by the hospital food. He had the specific dignity of someone who hated needing help but was managing it with reasonable grace, and he'd been asking every nurse who came in whether anyone could get him a newspaper. Sera found him a newspaper. He thanked her with the gruff brevity of someone who didn't give thanks easily, and she updated his chart and moved to 42. This was the work. This was also the work. The small, necessary, specific attention to the person in the bed, regardless of what was happening around them or to them or about them. She had always understood this. The years before had given her the capacity for the large moments, the acute events, the things that required her to function at full capacity under pressure. But it was this, the woman in 47 who noticed that someone was actually paying attention, the man in 41 who needed a newspaper, that she'd come back to after those years, and that she'd stayed for. She was finishing 44's chart update when Abner appeared at the ward entrance. He looked like he'd finally slept for about 20 minutes, which was still an improvement over before. "Bask is out of the interview," he said. "He's on the floor." "I know. He's asking about you." She didn't respond to that. She saved the chart, clipped her pen. "Webb came back in," Abner said. "He heard what happened in 3. He's been talking to Ruiz." A pause. "People are talking, Sera. People always talk. This is different." He stood in the entrance with his hands in his coat pockets. "What you did in there, in the OR, that's going to be in the official incident report. Reyes is documenting every detail. That report goes to clinical governance, to administration, to the board." She looked at him. "There is no clinical governance right now," she said. "It's under federal investigation." "There will be," he said, "whatever replaces it. And when there is, your name is going to be in that report." He held her gaze. "People are going to want to know who you are." She put her pen in her pocket. "They've always known who I am," she said. "They just chose not to look." She went back to work. What? At 6:45, with 40 minutes left in her shift, Marsh called. "The drives are recoverable," she said. "Partial data loss in about 30%. But the core supply chain documentation and the clinical governance files are intact. We have the original versions of your reports, time-stamped, unaltered." Sera was in the corridor outside 46. "All right," she said, "which means Hale's argument that your reports were unfounded or procedurally deficient, the argument we expected her to make, is gone. The reports are there. The responses are there. The pattern of suppression is documented." Marsh paused. "And the Aldervane connection is documented. The medical supply component. The pop-up clinics. All of it. How long until charges are formalized?" 24 to 48 hours for the full scope. The federal elements will take longer. That's the nature of that process." Another pause. "But Dredd is moving fast. He wants the grand jury convened within 2 weeks." The shift was ending. She could hear the incoming nurses beginning their handoffs at the far end of the corridor. "One more thing," Marsh said. Her voice shifted slightly. "A different register, not operational. Colonel Tron asked me to pass something along. He said to tell you that the pattern recognition you used in OR3, the VF management, the conversion sequence coaching, matches the advanced trauma protocols from your last combat deployment." A beat. "He said the Army spent 3 years teaching you that, and it would be a waste for it to only ever happen in the dark." She stood in the corridor for a moment. The building hummed around her. Somewhere above her, Tully was in the ICU with his chest closed and his heart in sinus rhythm. Somewhere on the second floor, a server room still smelled of smoke, and the filing cabinets were gone, and what was left in the drives was enough. Somewhere in a federal holding facility, Holloway was talking, and the names he was giving were going into a record that would take months to fully untangle, but had already begun. She put her phone in her pocket. She finished her shift. At 7:23 p.m., she was crossing the parking lot to her car when she heard footsteps behind her, unhurried, deliberate, not catching up so much as arriving at the same point. She turned. Bask. He was in street clothes. He'd changed out of his OR gear at some point in the afternoon, which gave him the slightly unfamiliar quality of a person you usually see in one context appearing in another. He was 63, with a surgeon's hands, and the specific weathering of someone who had spent decades in high-stakes rooms. He looked tired. He also looked like someone who had come outside specifically to have this conversation and had thought about what he wanted to say. "Dr. Bask," she said. "Walk with me for a minute," he said. They walked. The parking lot was quiet, the cold coming off the mountains steady and dry. "I read Reyes's OR documentation," he said. "He filed a preliminary incident report at 6 p.m. It's 23 pages. He's thorough," she said. "He documented the conversion sequence in clinical detail," Bask said. "The epinephrine timeline, the amiodarone loading dose, the internal massage technique, the defibrillation parameters," he paused. "He also documented extensively who was guiding him." She said nothing. I've been in surgery for 31 years, Bask said. I have had a certain understanding of what the people around me were capable of, based on title, on training, on the categories I'd put them in. He stopped walking. She stopped too. I've been revising that understanding this afternoon, he said. The parking lot was empty around them. The hospital behind them put out its low industrial light. Hale put you in observation, he said. I knew about the reassignment. I knew about the protocol reports. He looked at her directly. I didn't intervene. No, she said. I should have. She held his gaze. Yes, she said. You should have. He took that without looking away. It was, she thought, one of the harder things to do. To receive a fair assessment without deflecting it or qualifying it. He did it the way she'd have wanted anyone to do it, which was directly. The board is going to convene an emergency administrative review, he said. Clinical governance, executive administration, the procurement chain, all of it. Dredd's office has already been in contact with the board chair, he paused. They'll be looking at staffing decisions, reporting structures, reassignments made in the past 2 years. She understood what that meant without him saying it directly. And the nursing staff's clinical safety reports, she said. All of them, yours included. He put his hands in his pockets. There are going to be a lot of conversations about what this hospital missed, about who tried to report it and what happened to them when they did. The cold was significant now, the kind that required a coat to be doing its job. There's going to be an interim administrative structure while that process runs, Bask said. The board chair asked me to serve as acting medical director until a permanent replacement for Hale is identified. He paused. I told him I'd do it on the condition that the nursing staff reports are reviewed before anything else, that the people who raised concerns and were penalized for it are identified and their cases are reopened. She looked at him. He agreed, Bask said. She stood with that for a moment. That's the right call, she said. Not warmly, not coldly. As a fact, because it was one. I also told him, Bask said, and his voice shifted slightly here, something more careful coming into it, more deliberate, that the review should include a formal assessment of how this hospital classifies clinical expertise across all staff categories. She looked at him steadily. What does that mean specifically? She said. It means, he said, that what you did over the past 72 hours, what you've apparently been doing for 4 years, if the reports are accurate, and they appear to be, doesn't fit inside the category of floor nurse. And the fact that we forced it to fit inside that category, while it was the thing keeping our patients alive, is a structural problem. He met her gaze. One that needs to be corrected. She was quiet. The parking lot. The cold. The hospital's light. She thought about the notebook and federal evidence. She thought about Okafor walking under his own power to the elevator. She thought about Tully's chest, closed, heart and sinus. She thought about Farr and 46 with an INR of 4.2 and a prescription from a doctor who didn't exist. She thought about 8 years of learning and 4 years of being filed under staff exceeding professional scope. What are you proposing? She said. Bask opened his mouth to answer. His phone went off. He looked at the screen. His expression changed. Not alarm, but the shift that happened when something unexpected arrived that required immediate attention. It's Dredd, he said. He answered. She watched his face. Whatever Dredd was saying, it was brief. Bask listened, asked 2 short questions, got 2 short answers, and ended the call. He looked at her. The network, he said. The upper structure Holloway's been identifying. He paused. One of the individuals named, someone who was receiving distributions from the Aldervane operation, someone who helped facilitate the hospital access in the first instance. He stopped. She waited. It's a physician, he said. Someone on staff here. Another pause. Someone who filed the original protocol deviation report on you after the Okafor case. The parking lot was very still. Spill, who had come to her that morning with the Farr coagulation results, who had shared the pharmacy's search findings, who had told her he'd tried to reach Hale and gotten voicemail, who had positioned himself, she understood now, with the cold clarity of someone recalibrating a map they'd been reading wrong, as a person discovering the problem alongside her, while being part of the problem. The protocol violation report hadn't been bureaucratic reflex. It had been the first move in a managed strategy to reduce her access and her visibility before she got close enough to the supply chain to make the connection she'd almost made 18 months ago. Bask was watching her face. "You didn't know," he said. "No," she said. "He was in this building today," Bask said. "He had a patient in observation. He had been in observation. On her ward, with access to her locker." She called Marsh before Bask finished his sentence. Not because she'd stopped listening. She heard everything he said, filed it, processed it, but because the operational calculation was immediate and didn't require deliberation. Spill had been on her ward. Spill had access to the observation level. Spill had come to her that morning with information that had positioned him as an ally discovering the problem in real time. And she had partially believed it because he'd seemed genuinely shaken, and she had allowed that to count for something. It had been performance. She understood that now the way you understood something when the last piece arrived and the shape of the whole became clear. Not gradually, not with satisfaction, but with the flat, cold recognition of a miscalculation you couldn't undo, only account for. Marsh answered on the first ring. "Spill," Sera said. "Aaron Spill. He's named in Holloway's statement." A beat. She could hear Marsh moving. "When did you get that?" Bask just got off the phone with Dredd. "Spill was on my ward today. He had locker-level building access through the observation corridor. If the locker—" "I'm on it," Marsh said. "Where is he now?" "Unknown. Last confirmed location was the observation ward, mid-afternoon." "Stay where you are." She hung up. Bask was watching her with the specific expression of someone who had spent 30 years making fast decisions and recognized the quality in someone else. "He might still be in the building," he said. "He might," she said. "Or he saw Holloway come in with your agents and he left. Security can pull his badge swipes." "Call them," she said. He did. Right there in the parking lot, in the cold, with his phone to his ear and his breath showing in the air. She watched him navigate the extension tree for hospital security with the blunt efficiency of a man who had been calling hospital departments for 3 decades and had no patience for hold music. He got through, asked the question, waited, looked at her. "He badged out at the south entrance," he said. 14 minutes ago." 14 minutes. She'd been in the parking lot for 8. He'd left 6 minutes before Dredd called Bask, which meant he'd left before the call, which meant his departure wasn't triggered by the call. He'd known before Dredd called. He'd known something was closing, and he'd moved when the timing felt right to him, not when the information confirmed it. That told her something about his read of the situation. He was better at this than she'd given him credit for, which was not a comfortable thing to know, but was a useful one. "He knew before Dredd's call," she said. "How?" "Someone in Holloway's channel, or he saw the agents in the building and made the calculation." She paused. "He's not running. He's a physician with 30 years of institutional standing and legal resources. He's going somewhere controlled, somewhere he can manage the narrative." Bask was already dialing again. Not security, a different number. "Who are you calling?" she said. "The board chair," he said. "If Spill contacts the board before we do, he'll frame it as a misunderstanding, an investigation error. He'll get ahead of it." She nodded. "Call." He called. She listened to his side of it, concise, controlled, not without a certain grimness that she thought was probably genuine. Bask was not a man she'd fully assessed until the past several hours. It was more than she'd thought, and more conflicted, and the conflict was not nothing. It was evidence of a conscience that had been operating below the threshold of action for too long but hadn't been absent. He ended the call. "The chair's been briefed," he said. "He's contacting the board's legal counsel. Spill won't get a sympathetic ear there tonight." She said nothing. "You don't think it's enough," Bask said. "It's part of it," she said. "Dredd has the rest." They went back inside. Marsh found Spill at 9:17 p.m. at his home address, a house in Millhaven's North District that he'd owned for 19 years and that sat on a quiet street lined with mature elms. He was in his kitchen. He had a glass of whiskey he hadn't touched, and a laptop open to what appeared to be a draft email when the agents came to the door. Sera didn't learn this directly. She learned it through the specific network of information that flows through a hospital after hours. Linda calling from home because Linda's sources were extensive and she used them deliberately. Abner texting a 2-line summary from the ER break room, Bev from the OR recovery floor who had apparently overheard a conversation in the corridor near Dredd's temporary command space on the administrative level. She was home when the last piece came through. She was sitting at her kitchen table with a bowl of soup she'd heated from a can and a glass of water, and the specific quality of quiet that she'd been managing her relationship with for 4 years. The quiet that was either rest or absence, depending on the night. Tonight it was something in between. Spill had been receiving payments from the Aldervane network for 22 months. His role had been narrower than Hale's. He hadn't been involved in the infrastructure fraud, the falsified inspections, the Brannick work order. His specific function had been the hospital end of the pharmaceutical operation. The Aldervane Medical Partners pop-up clinics ran prescriptions through his DEA credentials. Without his physical presence, without his direct involvement in patient care, but with his name and license number on documents that made the prescriptions appear legitimate. In exchange, he'd received monthly payments through a shell consulting entity. When Sera's supply chain reports threatened to expose the medical device diversion, the pressure regulation valves laundered through Hargrove's procurement system. It was Spill who had flagged her as a risk. Not Hale initially, Spill. He'd identified her reports as dangerous to the network's cover and communicated that upward through Holloway's channel. Hale had acted on the intelligence he provided. The reassignment to observation, the protocol violation file, the accumulated suppression of her clinical concerns. All of it had begun with a report filed by a man who had come to her ward that morning, pretending to discover what she'd already uncovered. The protocol violation report after the Okafor case had served two purposes. It had reduced her access and credibility inside the hospital, and it had created a documented record of her as someone who operated outside appropriate boundaries. A record that could be used to discredit her if she ever pushed the supply chain issue far enough to require discrediting. 22 months. 11 patients with fraudulent prescriptions. 7 adverse outcomes. 1 man dead from a medication-induced bleeding event that had been attributed to his underlying cardiac condition and closed without further inquiry. She sat with that number, 1, for a long time. The soup went cold. She didn't notice until she was already done with it. Spill was formally charged on Friday morning. Federal charges, identity fraud, criminal facilitation, conspiracy. The Colorado Medical Board suspended his license the same afternoon, with a notice published on their public database that used language she'd never seen in a medical board notice before. Suspended pending investigation into criminal conduct involving misuse of prescribing credentials in connection with patient harm. Public, consequential, clear. She read it on her phone in the hospital parking lot, sitting in her car before her shift. Not with satisfaction exactly. Something more complicated. The feeling of a reckoning arriving at the right destination after being redirected through the wrong channels for long enough that you'd stop trusting it would arrive at all. Hale's charges had expanded overnight. The DA's office had added criminal endangerment, 4 counts, for the Brannick deaths, on the basis that her suppression of the supply chain reports had directly enabled the continuation of the infrastructure fraud. Her attorney had issued a statement disputing the characterization. The statement was the kind of legal language that built walls without denying the rooms behind them, and Sera read it once and set it aside because it would be resolved in a process that was now moving without her needing to push it. She went to work. The observation ward was different that morning. Not visibly. The beds were the same, the charts were the same, the equipment was the same worn-in gear that had always been there. But something in the quality of the floor had shifted, the way a room shifts after something that happened in it changes what the room means. People moved differently around her, not deferentially. She would have found that uncomfortable and slightly absurd, but with a different attention. A revised assessment, visible in small ways. The way Bev stopped in the corridor to say good morning and meant it. The way the ward clerk looked up from the desk and held eye contact a beat longer than usual, with something in it that wasn't quite what she'd been used to receiving. She did her rounds. She checked vitals. She updated charts with the same specificity she'd always brought to it. Abner found her at 9:30. "Tully's being moved out of the ICU," he said. "Step down." "Good trajectory." His wife's been asking about who was in OR3 on Thursday. He paused. The nursing staff, specifically. She moved to the next chart. "She can send a card to the unit," she said. "Sera." He stopped. She stopped. He had the look of someone who had something prepared and was deciding whether to say it the way he'd prepared it or to say it the actual way. He went with the actual way. "You're aware that Reyes's OR report has been circulating?" I assumed. Webb sent it to 6 people in the surgical department. Ruiz sent it to the department heads. He paused. Basque sent it to the board with a cover note. She looked at him. He wrote, Abner said carefully, that the report documented clinical judgment of a quality that this hospital had failed to recognize appropriately, and that the board's administrative review should include a specific examination of how that failure occurred and what structural changes were required to prevent its recurrence. She held that. He also wrote, Abner continued, and I'm being specific because I think you should hear the exact language. He wrote that the institution owed a debt to the people it had failed to hear, and that paying that debt required more than an apology. It required a change in what the institution was willing to see. She looked out the observation corridor window. The parking structure was visible from here. 3rd level, empty now, where the blue sedan had been. He's not wrong, she said. No, Abner said. He's not. She went back to the chart. The board convened its emergency administrative review on the following Monday. Sera was not present for the first session. She was on shift, and the board met in the executive conference room on the 4th floor, and those were simply 2 different places. She found out what happened through Basque, who came to the observation ward at 6 p.m. when her shift was ending and walked with her to the parking lot again, which had become, apparently, the place where he told her things. The board had voted to begin a full audit of the nursing staff's clinical safety reports filed over the past 3 years. Every report that had been received, acknowledged, and not acted upon would be individually reviewed. Staff members who had filed those reports and had received negative personnel action, reprimands, reassignments, deviation reports, would have those actions reviewed for cause, and where the cause was found to be retaliatory or discriminatory, the actions would be formally reversed and expunged from the personnel file. All of them, not just hers. There are 14 staff members, Basque said, nurses primarily. 1 pharmacist, a lab technician who filed a medication storage concern 2 years ago and was moved to overnight rotation a week later. He paused. The pattern is consistent. It goes back further than we initially thought. She walked beside him in the cold. Hale didn't build this alone, she said. No, she had a system that already had the architecture for it. She just used it more deliberately than her predecessors. He was quiet for a moment. That's not an excuse. It's a condition that made it worse and made it easier. The structural review, she said. The one you mentioned to the board chair, how deep does it go? All the way, he said. Reporting chains, clinical governance structures, the relationship between administrative authority and clinical staff input. We're bringing in an external firm, not internal, not municipal, to do an independent assessment. She looked at him. That'll take 6 months, she said. Minimum. Probably 9, he said. Possibly a year. He met her gaze. It should have happened before any of this. It didn't. Now it will. She nodded. They'd reached her car. The board also voted on something else, he said. He stopped walking. There's going to be an interim position. New title, Clinical Safety Liaison, reporting directly to the acting medical director, with a scope that includes both nursing floor operations and administrative review access. She looked at him steadily. The person in that role, he said, would be responsible for developing the new clinical reporting protocols, the ones that replace the system Hale corrupted. They'd also be part of the external review team's interface, the person who translated between the floor reality and the structural assessment. She understood what he was doing. He was being careful about it, framing it obliquely, and she understood why. It would have been easier to offer it simply, but easier wasn't the right way. Not after everything. Not after the years of the wrong way. You're asking me, she said. I'm telling you the position exists, he said, and telling you that the board has authorized me to offer it and that I think you should take it. He paused. I'm also telling you that you don't owe us yes. You could take everything that's happened here and walk out, and no one would have the standing to say you should have stayed. She looked at her car, at the parking lot, at the hospital behind them with its industrial light and its complicated history, and the 14 people who'd filed reports that had been buried, and the patients who'd been in the building when the system worked against them instead of for them. She thought about Okafor in the elevator, walking under his own power. She thought about Tully's chest, closed. She thought about Farr, whose INR had come down to therapeutic range and who'd been discharged on Wednesday with a prescription from an actual physician and a referral to an actual cardiologist. She thought about a man whose name she'd never learned who had died from a medication-induced bleed that had been filed as a cardiac event and closed without further inquiry, and who would be in the evidence record now, and whose case would be reopened, and whose name deserved to be in a different kind of file. She thought about what it meant to have spent 8 years learning to do something in the most demanding conditions imaginable, and then spend 4 years being told the thing you knew how to do was not the thing you were permitted to do. And she thought, this was the honest part, the part she would not have said out loud to Bask because it wasn't his to receive, that she was tired of the dark, not of doing the work. The work she would do regardless, because the work was the thing she was made for, and you didn't stop being made for something because someone decided not to see it, but tired of the specific darkness of being useful in a way that required concealment, of saving lives in the margins, in the footnotes, in the places where the institutional record would never name her. She was 32 years old. She had a long time left. "Tell me what the scope looks like," she said. Bask told her. It took 20 minutes, standing in the cold parking lot, and she asked 7 questions that he answered specifically and honestly, including the 2 questions about resources and authority that told her whether the position was real or cosmetic, and the answers told her it was real. "I'll think about it," she said. He nodded. He'd been expecting that. It was the right answer. Not the final one, but the right one for tonight, because saying yes immediately would have meant she hadn't thought about it, and she was someone who thought. He shook her hand. She noticed it. The gesture, the deliberateness of it. He'd done it like it meant something, because it did. She got in her car. She drove through Millhaven's South District on the way home. Not her usual route. She went through it deliberately, past the docks, past the site where the Brannock warehouse had been. The building was fenced now, the collapse stabilized, the investigation markers still visible around the perimeter. The street was quiet at this hour. 3 weeks ago, this block had been full of smoke and ambulances and people who didn't know yet what the day had cost them. She drove past slowly and didn't stop. She thought about the specific kind of damage that was invisible until it wasn't. The gas line that had been reported 3 times and not addressed. The supply chain reports that had been acknowledged and buried. The patients who'd received prescriptions from a name that didn't exist in any database and had gone home and taken the pills because a document had looked official and they'd trusted it. The infrastructure of harm was not dramatic. It was quiet. It was administrative. It was the sum of small decisions to not act, to not look, to not hear the person who was telling you something was wrong. Decisions made by people who found inaction more convenient than the alternative. She turned north. She thought about what she knew now that she hadn't known at 23, when she'd signed the papers that sent her into 8 years that remade her from the inside out. She'd thought then that the hardest thing was the acute moment, the event, the injury, the decision made under fire with incomplete information. She'd been right about that in a narrow sense. Those moments were hard. They required things of a person that couldn't be faked or borrowed. But the harder thing, the thing she'd only understood gradually, across years, was the sustained version. The commitment to seeing clearly when the institution around you was arranged to reward not seeing. The willingness to keep filing the report when the report went nowhere, to keep making the observation when the observation was unwelcome, to keep being the person who said this is not right in rooms that had been organized to hear something else. That took a different kind of resource. It took the specific stubbornness of someone who had decided that doing the thing correctly mattered more than the comfort of being accommodated, and who had made that decision so many times that it stopped being a decision and became a posture. She pulled into her building's lot. She sat in the car for a moment. She thought about the 14 staff members whose reports were being reviewed. 13 people who were not her, who had done the same thing she'd done, had seen something, documented it, reported it through the appropriate channels, and had been moved or penalized or ignored, and who had not had the particular combination of background and circumstance that had put her in the position to have this past week happen around her. They just kept working. She thought about that a lot, in the quiet of the car. She called Patricia Wen on Sunday morning. She'd thought about it since Linda mentioned the card, thought about it with the specific caution of someone who understood that a journalist's interest was not the same as an ally's interest, that information given for one purpose became material for another purpose. The moment it left your mouth, and that the events of the past week were already going to produce a record she had no control over through the federal case and the board review. What she could control was what she chose to say, and to whom, and in what shape. Wen answered immediately, which told Sera she'd been waiting. "Ms. Voss?" Wen said. "You know who I am," Sera said. "I do." A pause. "I was in the observation ward for 4 days. I had a lot of time to pay attention." "What do you want to write about?" "The 14 staff members," Wen said. "Not just you, the pattern, the system that made it possible for clinical concerns to be buried, for people who reported correctly to be penalized, for a hospital to be used as a resource by a criminal network, because the people who might have caught it were being managed into silence." Sera was quiet for a moment. That was the right story. Not the narrative version, the hero nurse, the dramatic OR, the single person who'd seen through the corruption. That version was simpler and would get more initial traction and would ultimately do less. The right story was the system, the 14 people, the reports that went nowhere, the architecture of not listening that had been built slowly over years and that had allowed harm to accumulate until it couldn't accumulate quietly anymore. "Not yet," Sera said. "No?" Wen's voice was careful. "The federal case is active. The board review is underway. The 14 staff members deserve to have their records reviewed and corrected before their names are in print." She paused. "When that process is complete, when the record is clear, I'll talk to you." A pause from Wen's end. "That's months." "Yes." "Will you still be willing then?" Sera looked out her window at the Sunday morning street. A woman walking a dog. 2 kids on bikes. Millhaven's South District doing its ordinary weekend. "I'll be willing," she said. "The story needs to be told accurately, and that takes time. But it needs to be told." "All right," Wen said. And then, after a beat, "For what it's worth, from the bed in 47, watching you work, you didn't look like someone who felt unrecognized. You looked like someone who knew exactly what they were doing and had decided that was enough." Sera thought about that. "It was enough to keep going," she said. "It wasn't enough to be the whole truth." She ended the call. On Monday, she accepted the position. She called Basque at 7:45 a.m., before her shift, standing in the hospital parking lot, in the cold with her phone and her street shoes and the particular steadiness that came from having actually thought about something, rather than just having felt ready. "Yes," she said. "Tell me who I need to meet with and when." He told her. She wrote it down. She went inside. She did her shift on the observation ward, her last week on the ward, as it turned out, because the position started the following Monday, and Basque had arranged the transition with the minimum of administrative friction. She did it the same way she'd done every shift for 4 years, completely, attentively, with the full weight of her capability applied to whoever was in the bed, regardless of what the board said their acuity was. Broken wrist, cardiac rule-out. Post-procedure recovery. Call lights answered, vitals trended, questions answered in the plain language that people in hospital gowns deserved. On Thursday, Tully was discharged. She didn't happen to be in the corridor when it happened. She heard about it from Abner, who said his wife had been there and had hugged 3 separate nurses and asked for names she could write down, because she intended to write letters, and she was not the kind of person who didn't follow through. On Friday, the federal grand jury was formally convened. Dredd's office issued a brief statement that named the Aldervane Network as the subject of a multi-state federal investigation into infrastructure fraud, pharmaceutical fraud, criminal conspiracy, and criminal facilitation in a healthcare setting. The statement named no individuals, which was standard, but it referenced Hargrove Memorial by name, and it referenced Millhaven, and it referenced the supply chain documentation as the evidentiary origin of the investigation. The document from which the evidentiary origin had come was her notebook. Now in federal evidence, properly logged, permanently part of the record. She thought about that, about the small notebook in her locker that she'd been keeping because documentation was a habit she hadn't been able to unlearn, because some part of her had understood that what she was seeing deserved a record even when the system was refusing to make one. The record existed. Whatever happened next, it existed. The first day of the new position was a Tuesday in the second week of November. The office was small, a converted consultation room on the 3rd floor, which she found appropriate, since the 3rd floor was where she'd given her statement to Dredd, and where the administrative corridor connected the clinical governance suite to the nursing staff records. Good geography. She could see the floor from here and the fourth floor above her, and that felt like the right position for the work. The work was not glamorous. She spent the first week reading reports, records, personnel files, the clinical governance documentation that had survived the fire on the server drives. She read with the same tight attention she'd brought to patient charts for 4 years, looking for the specific patterns that indicated not individual failures, but structural ones. The places where the system had been designed, consciously or by accumulation, to lose certain kinds of information. She found 12 systemic gaps in the first 2 weeks. Not dramatic gaps. Quiet ones. The kind that didn't announce themselves as problems until the problem had already happened. She wrote them down. She brought them to the external review team, who added them to the assessment framework. She brought them to Basque, who brought them to the board. She sat in meetings, not as a presenter, not as the person with the dramatic story, but as the person who had read the records and could speak specifically about what they showed and what would need to change for them to show something better. It was slow work. It was also the right work. Abner came to her office on the third Friday, with coffee that was better than the nurse's station pot because he'd gone to the good machine on the second floor, which he knew she wouldn't go to herself because it required a detour, and she didn't take detours when she was in the middle of something. He set the cup on her desk. Ruiz is starting a new trauma training initiative, he said. She wants to include case studies from the Brannick response. Good cases, Sera said without looking up from the file she was reading. She wants you to co-present. She looked up. She said, he stopped, chose the words carefully. She said the residents need to understand how pattern recognition actually works. Not in the theoretical way. In the way it works when you're standing in the corridor and the patient's in the wrong bed and no one's looking at them. She thought about the woman in 47, the one who'd told her to go, the one who'd noticed she was paying attention when no one else was looking at her. She thought about Okafor with his gray-yellow skin and his pulse at 38, and the IV she'd hung without authorization, because the authorization structure had not been designed to account for the situation she was actually in. She thought about the 14, the pharmacist, the lab technician, the nurses who'd filed their reports and gone home and come back the next day and kept working. Tell Ruiz yes, she said. Abner nodded. He left. She went back to the file. Plus, here's what she had learned across the years, that she had never been taught formally, and that no document had ever written down in a way that captured it accurately. The most dangerous assumption in any institution is that the person with the title is the person with the knowledge. Not because titles are meaningless, they carry authority, and authority matters, and the structures that organize authority exist for reasons that are often sound. But authority and knowledge are not the same thing, and the gap between them is where harm accumulates. It accumulates quietly, in the margins, in the reports that get filed and not read, in the observations that get noted and not acted upon, in the people who keep doing the work correctly while the system around them keeps making the same mistakes and calling the mistakes something else. She had spent 4 years being called just a nurse by people who meant it as a diminishment and had instead given her the only cover she needed to stay close enough to the work to matter. She was not angry about those 4 years. She was not even now asking for sympathy about them. What she wanted, what she had always wanted, in the part of her that was honest about what she wanted, was for the next person who filed a report about a supply chain discrepancy, or a medication safety concern, or a patient being triaged into the wrong category to have somewhere to send that report that would actually receive it. For the next clinical safety concern to be heard the first time, not after someone died, not after 4 years and a federal investigation and a fire in the administrative wing. That was the work. It was not dramatic. It was not the story that Wen would eventually write, which would focus on the Brannick deaths and the pharmaceutical fraud and the OR and the network's collapse, because those were the things that the story's shape required. The story that Wen would write was true, and it deserved to be written, and it would matter. But the work was this: the gap between what an institution said it was and what it actually did, examined carefully, documented specifically, and revised without sentimentality toward the version that kept people alive. She understood that work. She had been doing it her whole life. She just had a room to do it in now, and a title, and a chair that faced the door, and a window that looked out over the hospital's rear garden where nobody ever went, except that on the second Tuesday of November, while she was working, she looked up and there were two people sitting on one of the benches. A man and a woman, bundled against the cold, the woman's hand on the man's arm. From this distance, she couldn't see their faces. She watched them for a moment, then she went back to work. Not because the moment didn't matter, but because the work was always there, and the people who needed it done were always somewhere in the building, in the wrong bed or the right one, with a chart that was complete or one that was missing the detail that would change everything. And someone had to be paying attention. She had always been paying attention. Now, finally,